Sahiti, you can go for live.
Yes, ma'am, we are live now.
Yeah. Dr. Madhumita CB.
Cable இல்லையா அதுல பாரு இன்னொரு பேக் வந்துடா லேப்டாப் பாரு.
Can I start the screen sharing?
Yes.
Can you stop the screen sharing, Priya?
Okay, ma'am.
Yes. 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 So, this very interesting 2 days webinar on research methodology. It's really a really confusing topic from the days of our UG days even till now. So yesterday our speakers have really elaborated and given crisp take-home points on this really interesting and also really confusing topic. So I thank the organizers for giving me the opportunity to recap yesterday's sessions in a few slides. So the first talk was by Dr. Nikita Prabhakar on what is the research question and how do you select your thesis topic. So basically, how do we start? We start by identifying a topic of interest and then next, narrow down the topic to a specific segment of that and focus on a specific subject. Then do extensive literature review around our specific area of interest. Then list down a few questions. You find your area of interest and then list down a few questions from this segment. Later, once you narrow down the segment, then select one question and then focus on that. Then use this finer criteria, that is whether the question, that is your thesis topic, is feasible, whether you'll be able to do it, how interesting it is, how novel and new it is, how ethical it is, and whether it is relevant to the current method of practice. So use this to check if your question is good and feasible. Next, use a PICOT template to construct your research question. The PICOT stands for the first, define your population and then define the intervention that you're going to give. Then later decide upon your control and what outcome you're expecting from that and the time frame that you want, whether you need 6 months or 1 year, the time frame that you want to give for this specific thesis. The second topic, a very interesting one, was by Dr. Anureka ma'am on types of research studies. So on the whole, research studies can be defined into can be classified into two criteria. One is the analytical one and the next is a descriptive one. The descriptive, in that we have 4 sub-classifications. One is a case report where you specifically describe a specific case report. Next is a case series where you describe a group of cases, and then the cross-sectional survey. Where a population is taken at one time and the cross-sectional survey is done and then that is described and the study is made. Later, ecological studies, a certain group of people, a certain group of population are studied at one time. So these 4 come under descriptive studies. Then what about the analytical studies? Under the analytical studies, there are 2 types. One is observational and next is the experimental. Under the observational studies, we have the case control, which is a kind of a retrospective study. Next is the cohort, where we start from where it's kind of a prospective one, prospective observational study. The next is the cross-sectional one. So these 3 come under the observational study. The next, under analytical study, we have the experimental studies. And in that experimental studies, we have either the RCTs or non-RCTs. Next, the community intervention trials, and then the pragmatic clinical trials, where we go to a specific drug and then see how it is efficacy and the side effects in that population. So these are the basic outlook of the type of studies. Next, the important one, when you're looking at a study, that is when you're looking for to research and you want to find out which study you should look into, comes this Haynes 6S pyramids. This stands for the 6 kinds of subheadings under which you can classify all the studies. Here, the quality of evidence, that is, as we know, the meta-analysis and the systematic reviews, they stand on top of this pyramid. That is, they have the most weightage. But these are the secondary studies. That is, the studies have already been done. And then we collect the data of all these studies, and then all the bias is eliminated, and then we come into a conclusion. So it is like that. The individual studies, that is the case reports, case controls, all this come at the bottom of this pyramid. These are the primary original research, but then again, the population might be less, and then it is not all the biases might not be eliminated. So like this on top. So whenever you're looking for a thesis topic, or whenever you want to look into the literature, always we aim to look at the top of the pyramid, the best studies. That is the look for this randomized control trials which come somewhere in the middle, and then look for meta-analysis, and then this is systematic reviews, all this. Then the third topic was again by Dr. Nikita Prabhagar, and this was on study methodology and sample size. How do we decide upon the study methodology that you want to do, and how do you define your sample size? So basically, how do we decide? We decide our study so that we can achieve our objectives using the selected research instruments. That is, our study, whichever, like whether we are going for analytical study, whether we're going for a descriptive study, with that, are we able to answer our research question? That is, should be a first and foremost question. Next, under the study, the research methodology, there are three types. One is the quantitative, the qualitative, and the mixed. Quantitative is basically, it defines a specific number. Like for example, if the specific, it gives us a cutoff. Whereas a qualitative is basically, again, it is basically like kind of a, for example, like it's the pain, the amount of pain, whether it's less, more, basically it is quantitative. It doesn't give a specific number to it. And there are mixed methods. So what about the sampling definitions and types? So in the samplings, there is also there is this probability sampling and non-probability sampling. In this probability sampling, basically the bias is eliminated. That is, there is a probability of that specific intervention of that specific person being either in this sample or in the other sample. So basically we try to eliminate the bias. Next, data collection methods. How do we decide how to collect the data? There are various data collection methods like questionnaires, then surveys, all this. So how do we decide? So we have to decide on which is the appropriate data collection method for our specific research. Next, the data analysis method. So the data analysis method depends upon our research, whether it is, suppose in case if it is a quantitative study, in that case, it is differential and inferential. Whereas suppose in case it is a qualitative study, then we have to look into how do we analyze the data. We look into the content, the narrative, the discourse and all this. So the next fourth topic was on literature search by Hepzibah ma'am. So basically, how do we decide on what literature to look into when you're doing your thesis or when you're looking to publish? How do you decide which literature or which studies that you should look into? So always aim for high quality studies, that meta-analysis, systematic reviews, and landmark studies, because at this in the Haynes pyramid that we just saw, these stand at the top. So they have the most weightage. And then we have to think why are we doing this literature search? Basically to understand the depth of the topic, to evaluate all the previous studies that have already been done relevant to this topic, and also to assess the previous data. So the purpose is to review the old theory, and then to know and decide which methodology you want to use, and to analyze the past data so that it can help you to derive your own data. Next, whatever research question, always before you form the research question, as discussed, always go by, see if it's feasible, whether you're able to do it, how interesting it is, how novel and new it is, how ethical it is, and if it is relevant. Next, then where do we go and search? Basically, PubMed, Embase, and Scopus. All these three platforms, they have huge number, millions of studies and publications which we can search, and which we can use our keywords, key concepts, research questions, and subject headings. Basically, when we go and search for our keywords, we get numerous studies, and then we can select which study we want to look into. And then what are the 5 steps which we follow during literature search? Basically, we follow this PISCO, that is plan using the PICOT. PICOT, what we already saw, the population, intervention, the control, the outcome, and the time for any research. So first do the planning, identify the database. What is your database of the population? Then start conducting the search. search for the relevant articles, select, and then start organizing these. Finally, literature review. So what happens literature review? Once you've already organized all this using Cisco, after that, look into the literature search in depth, and this is called as literature review. So the next topic was by Dr. Parthasarathi sir, and this topic was on statistics, the clinician perspective. So as clinicians, we always find statistics to be a little the gray area where we are always confused with this. So here, what are the basics that we need to know? Basically, biostatistics means basically organizing, summarizing, and analyzing the data from the biological studies. So what is a variable? Variables can be either quantitative, that is numerical, or it can be categorical, qualitative, which category, whether it falls under less, more, so which category it is. And further, it is divided into dependent variables, independent variables, or covariates. Next, data is usually presented using tables. It can be presented using tables. It can be presented using bar charts, histograms, line graphs, pie charts, box plots, scatter plots. So these are various ways in which data can be presented. So what are the measures of central tendency? The mean, median, and mode. These are three measures of this central tendency. And what are the measures of dispersion? Basically, that is how far our data varies from the central tendency. That is, this can be measured using the range, the variance, standard deviation, and coefficient of variation. So basically, so what is a normal distribution? When we have our data, we aim for it to be in a normal distribution. We should have a central, mean, median, and mode. So basically, a normal distribution is a bell-shaped symmetrical curve. So what is meant by univariate analysis? Univariate analysis basically examines the distribution of our cases around a single variable, whereas bivariate means two variables are analyzed, and then we study the distribution of our cases around both the variables. And multivariate variate is there are multiple, that is more than two variables. So any non-normal data may need to be transformed. Suppose in case we want to use certain statistical methods, we want to analyze using certain statistical analysis, any non-normal, that is any data which doesn't fall under this normal distribution, it needs to be transformed into a normal distribution. In case if it is not, then some statistical analysis cannot be used and others have to be opted for. So whatever tables that we are using in our data to express our study, that should be self-explanatory, and graphs should also be appropriately chosen for the data type with clear labels. So, and test of normality. Finally, we have to always see if our data falls under this normality so that we know which appropriate tool we can use for statistical analysis. So that is the summary and recap of yesterday's 5 very interesting talks.
That's good.
Thank you, ma'am. Thank you, Ramani ma'am, Sampath ma'am, for the opportunity. Yes, ma'am. Stop sharing.
Madhumita, I think that was an excellent recap of yesterday's topics.
Yes, ma'am.
So now let us move on to today's program.
Yes, ma'am.
Yeah.
Thank you, ma'am.
Sri Priya, share the chairpersons. Yeah. Sri Priya. Sakiti.
Yes, ma'am.
Yeah, yeah.
Ma'am, shared, ma'am.
Yeah.
Shared பண்ணிருக்கோம், ma'am.
Madam,
Okay.
it's all right. We'll just move on to the scientific session.
No,
ma'am.
today we have the, yeah.
Ma'am, shared பண்ணிருக்கோம், ma'am.
Okay, I can see. Today's, for the first talk, Dr. Jairani Kamaraj will be the chairperson. We all of us know very well. She has been the past president of Oxy, treasurer Taprisar, joint secretary TNFOG, and chairperson of the Sexual Health Committee of TNFOG, Associate Secretary of World Association of Sexual Health, Advisory Council member, and she has of World Association of Sexual Health and Board of Studies, MGR Medical University. And she has won so many medals and awards. And she is one of the leading ART consultants in Trichy. I mean, in Chennai. Sorry. In Chennai. Okay. So let us ask Jairani Kamaraj to introduce the first speaker.
Thank you, ma'am. Thank you for the nice introduction and a very special
Yesterday,
thanks.
Dr. Partharthi's talk was also very good, and I think she had given a very crisp recap of what he had done yesterday.
Thank you.
Yeah. Thank you. Thank you, madam. Thank you, Ramani, madam. And thank you, TNFOG, which is very close to my heart, for organizing that wonderful program, which are very beneficial for the postgraduates, the very important research methodology, which is very important for the postgraduates, and whoever in the profession to do a research. This is a very important aspect that TNFOG is looking for all the postgraduates. And I really appreciate and thanks and hats off to TNFOG organizers, President Madam Ramani Devi and Sampath, for making this as a priority to sensitize and educate all the postgraduates. And we have a lot of programs yesterday. Very nicely, Madhu has recapped all the talks and the contents and the high crispy. She has made it very nice for most of the people who didn't attend yesterday will be definitely benefited by her recap. And today we have another continuing topic for the research methodology today. Very important, how we have to write the reference. I think it is a very important topic that we have to look into it. Any person who is writing any chapter, any publications has to be aware how we have to write the reference. And today we have for this to talk on it in a very elaborative way and in a very knowledgeable way. We have Dr. Parthasarathy, who is the Associate Professor of the Department of Community Medicine, KAPV Government Medical College, Trichy. Sir has done his undergraduation from Tanju Medical College and post-graduation from the All India Institute of Hygiene and Public Health, Kolkata. And he has a teaching experience of over 10 years. And his key areas of interest is epidemiological studies, biostatistics, disease control, scientific wing and publications, medical educations. And also he has published more than 15 research articles in various national and international journals and participated and monitoring in the evaluation of various national health programs such as pulse polio immunization, mass drug administration, filariasis, investigations in UNICEF projects, and assessment of A&M training centers in Tamil Nadu. And he has been an evaluator of sub-national certification for elimination of tuberculosis by the Trichy district in 2023. And he has been trained and certified in fundamentals of biostatics, principles of epidemiology, and the statistical package for the social sciences, that is SPSS, and multiple linear and the logistic regression modeling and survival analysis, which are the mainstay for any research methodology, which is very important for anyone to know. And he has been the resource person for the research methodology and biostatistics workshop conducted by the Tamil Nadu MGR Medical University for all the medical faculties and the postgraduates for the past 5 years. And we are really honored to have you, sir. On behalf of TNFOG, I welcome you to deliberate your citation about this, how to write the references, which will be a very important topic. Over to you, sir.
Thank you, ma'am. Thanks a lot for the brief introduction. We'll start right away. Just Can you see my screen in the full screen mode, ma'am?
Yes, yes, sir.
Anyone?
Yes, sir. Yes, sir.
Yes. So let's start right away. Reference writing is writing references is very, very important, as ma'am said, because whenever you write a book, a chapter of, when you contribute for a chapter of for a particular book, or when you're writing, frequently we use references. We have to write references starting from our postgraduate days when we are writing thesis, and now we are usually publishing papers. So whenever we go for any journals, we are required to write references in a particular format. Usually, almost 90% of the journals which we deal with in medical literature, they usually prefer references in this bank of format. So the most commonly used medical journals, most commonly used format in the medical journal system is Vancouver system. But when you go for other kind of journals, especially in the which are associated with North America, there they may be asking, some journals may be asking for a particular kind of a particular type of reference formatting like APA, Chicago, or Harvard formats. So before you write your paper, you have to decide on what kind of journal or what journal you are going to publish. Then you go to the journal website and look into the instructions to authors in this section. So in the instructions to the author section, you will be able to find what are the reference formats they recommend. So usually if they mention Vancouver system, then fine. So otherwise, if they mention Chicago or APA, you need not worry at all, because nowadays we have very powerful softwares to write references. Previously, it was very difficult to write references, but now because of these softwares, it's very, very easy. So usually whenever we write a paper, usually in the introduction section or in the discussion section, whenever we cite a particular data or a data point or a particular magnitude of a particular disease or kind of thing, whenever we cite other people's work, we are required to give references, give citations, and give references at the end of the article. So if you see the Vancouver format, it's a numerical numbering system. Vancouver is a place in the US-Canada border. It actually comes in the Canada. There they had this conference, and in this conference, they decided this kind of referencing system. So that's why it's called Vancouver format. In this format, it's a numerical style referencing system where it will, whatever you cite from in the first page or in the first thing will be numbered as 1. And it will be sequentially numbered again and again. I mean, when you keep on proceeding with writing the papers, the references are given as 1, 2, 3, 4 in a sequential way. If you are repeating, I mean, if you are citing again the paper which is already cited before, then you have to repeat the same number again. You need not give the new number again. You should not give a new number. So you have to repeat the same number again, and you have to include in the list of references at the end of the research paper. So now with this kind of softwares we have, you need not worry about all these formattings and all. So I'm going to show a demonstration on how to use one such software called Zotero. Okay, Zotero is very, free to use for everyone. Anyone can download it and you can use it on your laptop. So if you see, this is the example. So if you're writing this sentence, so it has been noted that performance does not always match with expectations. You are supposed to cite it in brackets or as a superscript according to the journal's requirement. So in the instructions to the author's page, they will write referencing format. The citation should be given in superscript or within the parenthesis next to the sentence or something like that. So follow this kind of in-text citation. Then at the end of your article, you are supposed to attach the reference list. So this is a typical referencing, Vancouver type of style of referencing, where usually the author's name is given at the beginning. Then comes the title of the study. Then comes the internationally approved name or the abbreviation of the journal. Then comes the year of publication. Then comes the issue, and within that issue, the volume and the issue, and then the page numbers. So all these semicolons, colons, parentheses, all these things are very, very important. Manually doing citation is very, very hectic, and it's literally impossible to do correctly without any mistakes. So that's why we always recommend using softwares such as Zotero. So you have to cite not only the articles, but also online journals, books. If you are taking some important text from books, or if you are taking some frequently from websites. So we may cite, usually in our field, we used to go to World Health Organization, WHO website, and we used to cite some things which is given in the websites of CDC or WHO. So how to cite those web pages? We will not be having articles, downloaded articles, but instead we can cite the websites. So which were the authentic websites, if they give this relevant information, you can cite the websites also. So all these things can be done easily using the softwares. So one such software is Zotero. The most widely used is Zotero and Mendeley. Okay, people prefer Mendeley and Zotero. So for me, Zotero works well. And if you prefer Mendeley, Mendeley also does fine. But almost if you know how to handle Zotero, then Mendeley is also very easy. So one such thing is Zotero. We are going to see, I will show you a demonstration on how to use Zotero for writing references. Okay, so for learning Zotero, you have to go to this website, zotero.org. If you people are sitting with a laptop, you can try immediately. So go to this Zotero.org website and you can click on download Zotero for Windows option. Okay. So once you download Zotero, the Zotero will always will along with it, you have to it will automatically download this Zotero connector in your Google Chrome browser, and it will also download a separate MS Word, Microsoft Word plugin. So all these things will be downloaded along with the Zotero software. See, this is the Zotero software. Along with this, it will download a plugin for Google Chrome. So once you download a connector, Zotero connector to a Google Chrome browser, it is very easy. So by the time when you are doing literature review itself, you can easily import or download all the articles from the literature review, and all these articles will be connected to your Zotero account. From that Zotero account, citing each and every article becomes very easy. So along with this, we have this word processor plugin, which is nothing but it links the Zotero to your Word document. Okay. So first you install the Zotero in your laptop, then you install this Zotero connector. Okay. It is a Google Chrome extension is there. So just search for Zotero connector. You can easily install. Then if you open Word document, you will naturally see I'll show you. So there you will see a Zotero icon. So that is usually installed when you install the Zotero 6 itself. Okay. After you install, I will show you this is the Zotero page. After you install, if you open Zotero, you will be able to see 3 panes. This will be the menu option here, and the left side it will be your library. Okay, where you can create folders for each and every publication or article which you are writing. And within each folder, you can include your list of studies. And here the details pane will be there. I will show you that. So this is how a Zotero software will look like. So if you have any doubts, then and there you can ask me, because I'm going to demonstrate simultaneously. So because I've installed Zotero here, are you able to see Zotero icon, Z icon here? So once I click the Zotero web page, I mean Zotero app. So this is the Zotero app. Are you able to see my screen?
Yes, sir, we are able to see.
Yes, thank you, ma'am. So if you see here, this left side will be my library. This will be the articles, and this will be the information section where you can take notes. So I can open this PDF document and I can take notes, and I can type it here. Okay, whatever I need from this particular article, I can do it here. So within this software, you have to be familiar. So here you can see the top left corner, you will be having a small thing, which if you click on it, it will ask to create a new collection or a new folder. Once you name the folder, you can include all the articles here. I've created a folder in my thing called demo. Okay, so let's see how to import the articles from literature review. After literature review, how to bring those articles to this folder. Okay, if you already have downloaded all the articles, then you just have to click here and you can add the articles easily. Otherwise, see, just click here, attach the stored copy of file. It will open the desktop and you can select all the articles in that particular folder. So it will open this here. So if you just select the folder, all the articles, if you select, it will automatically come to this middle pane. Okay, inside the demo folder, whichever folder you want. So otherwise, I want these articles. I usually what you do is I bring the articles from the internet itself when I search for PubMed. So let's go to the Google Chrome. Here, this is my Google Chrome. Okay, so this is my Google Chrome browser. I have installed Zotero connector here. If you see here, there will be a Z button which will be visible in the top right corner here. Okay, this is a Zotero connector extension. So now just I went to PubMed. Now I'm going to demonstrate on how to use this thing. So usually in PubMed, what we do when you are searching literature, you should not use this icon, because we already saw how to search for literature using Boolean operators. So now you are supposed to click on advanced option. Go to PubMed, click on advanced option. Once you click on advanced option, you will get this kind of PubMed advanced search builder. So in this advanced search builder, so here what I'm going to do is I'm going to click on this first box, all fields box. Instead of all fields, I'm going to select only title. Okay, title or abstract. And here I'm going to enter the term gestational diabetes mellitus. Say for example, gestational diabetes mellitus. Okay, so if you want to use mesh terms, you can click on here, select mesh terms. From the mesh library, you can use mesh terms for demonstration time wise. I mean, I'm showing this. So gestational diabetes, I'm clicking on add. So it will add all the articles to the query box. Okay. So gestational diabetes is added here. Now what I'm going to do is I'm going to same title. I'm going to type India. So I want all the articles which mention gestational diabetes mellitus and India in the title. So click on and. So now gestational diabetes mellitus and India will be my this thing. So just so here once I click search here, I'm getting only how many articles I'm getting. So leave the review here. So I'm getting 4 articles. So for there are only 4 articles in the PubMed which cites gestational diabetes mellitus and India in the title itself. 4, 5. Okay. So now we have more articles. So now we have 4 pages. Sorry, 39 results. 4 pages are visible here. So now I will filter out whatever articles I want. So I want only the latest articles by year. So from 2004, I'll use only 2022 to 2024. I will use only the latest articles. So only 2 articles, only 11 results are there. So now what I will do is I will use only, then I will filter only the 1 year, last 1 year. So whatever articles were published in the last 1 year, only 6 articles are there. So full text articles, I will use only based on the type of study. I will use the randomized control trials and review articles. Okay, so only one study was there, so it directly opened the randomized control trial instead. So let's say, so now that we have 6 results in this page, I'm going to click on this Zotero connector here. Okay, the folder button. See here, I'm going to import all these 6 studies to my demo folder. Okay, so I'm just clicking on this website. Clicking on this icon here. So once I click, it asks, see, there are 6 results in this page. What are the things you want to store in this Zotero? I'm just going to click on select all. Once I click select all, you can customize it. If you don't want the study, leave it. I'm going to click on this. I've selected all the studies. I'm going to click OK. Once I click OK, it shows me here that saving to demo. Okay. All these 6 articles are saved to demo folder. If I want to change the folder, I will change it here. Okay. For now, I'm leaving it as demo folder. Now let's go to demo folder and see for this articles. So all these 6 articles will be sitting here. Say, for example, the incidence and risk factors of postpartum diabetes, prevalence and determinants, all these things will be in the association of common variables. Now I'm going to Zotero here. Now you can see here, so all these 6 articles were present here. So let me first delete all these things. So now that you know the demo folder is empty, I'm redoing it. So I'm selecting all and I'm clicking OK. Okay, saving to Zotero. So let's go to Zotero here. See, automatically the 6 articles are there. And can you see the PDF document here? See, it's duplicated now. Can you see the PDF documents here? So Zotero, what it does is it automatically searches the internet. And if PDF document is available for that study, it will download the PDF automatically. Okay, that is one more helpful thing from Zotero, because I did not click on each PubMed link, go to the website and download the PDF article. I just have to remove the, I just have to import it to my Zotero folder, and then I can easily search for these things. So by this, I hope you're all clear in how to handle, just a minute. So now you are clear on how to link the Google Chrome browser using Zotero connector here, and you can link it to the Zotero account. Now that we have this thing, now I'm just clicking on this national and regional prevalence of this thing. I just double clicked it. Zotero just opens the PDF article which it has automatically downloaded. So this is a meta-analysis on gestational diabetes mellitus. What I'm going to do is from this, I'm going to say, for example, I'm writing this. The World Health Organization reports the fundamental definition which states these things. Okay, I just want to cite this. Okay, I just want to cite this. Say, for example, so I'm opening my Word document. Okay, or you can do it here. You can add tags. You can go to this demo folder. From this article, you can take notes here. Okay, you can add notes. And for this, each article, I'm taking notes. So I'm typing it here, guest assistant decimal letters, and from the PDF document which I have copied, I can copy and I can post my whatever notes I want. Okay. So once I've taken the notes, you can easily download it. I mean, you can easily type it or paraphrase it. Now I've typed the definition of Zotero according to WHO. Okay. So whatever, and I will just copy paste from that PDF here. Now, if you see carefully, after you have installed Zotero, if you open the Word document in the menu pane here in the headlines, you will be able to see this Zotero icon. You just click on Zotero. You will be able to see these options: add citation, add bibliography. These two are very important. And once you open it for the first time, it will ask for document preferences. When you open for the first time, this page will appear. Okay, when you open the Zotero for the first time, you will be able to see this page. So in this page, what you do, you select Vancouver. So you just use Medline journal abbreviations, automatically update citations, and whatever default option is there, you don't change anything and click OK. Once you click OK, Zotero is there. You just, now I am going to cite that document. How I am going to cite this document? I'm going to click on add or edit citation. Once I click edit citation, see this red ribbon appears. So click on the Z icon here. After this ribbon appears, click on Z. Now click on classic view. Once you click on classic view, immediately whatever folder was open appears here. See, the demo folder is appearing here. I took this sentence from this. I want to cite this article. So I just click on this article. So if this article is 10 pages, I just have to enter the page number as 9. And I'm just clicking OK. Once I click OK, see, Zotero already automatically gave this number as 1. Okay. Now I'm typing something and then I want to cite the second one. Again, I do it. I click on add citation. I click on the Z icon. I click on the classic view. I select some other article. Okay. I select this article and I'm clicking OK. Now it automatically gives the numbering as 2. Now, whatever you do, you can type and you can give this numbering. After I've done my article, what I will do, I will give the headings as references, or instead you just click on add or edit bibliography. You just click on edit bibliography. Zotero automatically gives number 1 as this reference, number 2 as this reference, exactly according to the Vancouver format. Okay. Typical Vancouver format styling will be used. And if you want to change, I've written in Vancouver format, my journal is asking for some other style. Then I will click on document preferences. I will change the style for Nature, for APA style, for Chicago style, for ASA style. So whatever style you want, if you just change it here and click OK and refresh, it will automatically update. Okay. See here, it will automatically done. Now what usually we do is, sometimes after corrections, we bring this sentence here and before, and now the order has to be changed. So this has to become 1 and this has to become 2 now. What I do is I just click on refresh. Okay, I just click on refresh. See what happens. Mantri et al is number 1 and Gupta et al is number 2. So what I'm going to do is I'm just clicking on refresh. Once I click refresh, already it automatically the numbers also change and the reference list also changes. So the Gupta et al comes at number 1 and Mantri et al comes to the number 2. So this reference is automatically linked to this sentence or this number, and you need not worry about changing the numbers again and again. You just have to click refresh and this list of references is automatically generated for Zotero. So now I'll show you one more thing on how to cite the web pages. So WHO web page. So I want to cite this World Health Organization web page, or for your OG associations or something, if they are saying particular things, you just have to click here. Again, save to Zotero is there. This web page, you click on save to Zotero. It will be asking, sorry, before that, right click on Zotero. So save to Zotero, if you click here, it will ask web page with snapshot, without snapshot. I will be using without snapshot. Once I click without snapshot, saving to demo. Okay, it automatically saves to the demo folder. Once you go to the demo folder here, see, you can automatically see the standards here. See, this is the web page which we are which we are, sorry. So this automatically the standard pages included in our Zotero folder. Now you can go there and you can easily cite even that document also. So now add citation. Again, click on Z, classic view, go to the demo folder. I'm clicking on this standards, which is a WHO web page, and I'm clicking OK. Okay. So now the third citation is included here. See, automatically it is updated here. Standards internet cited on the date, available from the web page link. So all these things are automatically done using Zotero. Now, referencing is very easy. Once you use the software, it becomes very, very easy to use these kind of, the referencing formats become much easier to use Zotero. So with this, if I'll take questions or doubts, if you have, we can do it. So you can add citations manually for books or particular journal articles, or if you have only the PubMed ID, you can click on PubMed ID and you can easily enter. So this is the Zotero connector, which you are supposed to install in the Google Chrome browser or whatever browser you use, you can, Zotero connector is available. So this is how we use for the World Health Organization websites. These are the three options which will be available in the Word document. Once you install Zotero, Zotero will be visible here near the file home button. If you go near the add-ons, you will be able to see Zotero. So for inserting citation, you just have to click on inserting citation. For inserting the list, you just have to insert bibliography. If you have changed something, you just have to click on refresh. So it's very easy to use. So different kinds of formatting can be included in the same Zotero itself. So with this, I conclude my presentation. Thank you all. Thank you.
Thank you, sir. Thank you so much for the reference writing. Definitely, your talk has been so simple and clear and crisp and very much up to the point that you have clearly mentioned everything about the importance of reference writing whenever, and also about the search, that how we have to make and how we have to do. And very interesting, you shared your experience also. It is so nice, Dr. Parthasarathy, for being here. And it's really very useful for your talk, which can be really educational to the postgraduates and all the other people who are aspiring to do a lot of research work. Thank you, sir. Thank you for being with us.
Thank you. Thank you. Thanks
If there is any questions in the chat box also, you can see and we can go through it. And in between, if you're free, you can answer the questions also, sir.
Do we have to use the exact same words if quoting an article, or it is okay if we change to come to some extent and then cite? You should not use the exact same words if you are quoting the article or this thing. So that will be considered as plagiarism. You have
Plagiarism,
to give yes. So yes, ma'am. So you have to infer. You have to understand what they say, what they mean. You have to get the point, what they are meaning, and then you have to paraphrase it and you have to write it in your own words. So then you have to give citations. So even if you write it in your own words, like many people think that only if you copy paste it, you have to give citations. It's not that. Even if you take the idea from that author, then also you are supposed to give cite that particular article or the author. So in that case, you have to do it. And please avoid citing the exact phrases. So if it is definitions, you cannot change much. So in those kind of things, you can give within quotations, you can cite, and for definitions, like we saw the example for gestational diabetes mellitus. So definitions you should not write actually in your own sentence. So those things you can give it within quotations. If you are giving exact same words, quotation marks is a must. Okay. So otherwise you should not copy the exact same words from the author. Is it mandatory to have ORCID ID for index journals? No, it's not mandatory actually, but many index journals, they ask for your ORCID ID to just prove your identity that you are a researcher. And giving ORCID ID is always better because it links your journal article to your research. It's an ID card. It's like your research ID card. So once you give your ORCID ID card, once you show your research ID, you need not say, I published this many articles in this many journals. You just have to mention your ORCID ID. They will automatically, it will reflect this thing. And also nowadays people started giving credit for reviewing. So people, we usually review many articles. We are reviewer for many journals, and we will not get much credit. Now what they do is they give some Publon points. When you review an article, they give more credit points like thing. So those credit points are linked to your ARCID ID. So once you log into your ARCID ID, you will be able to see how many articles you have published, how many articles you have reviewed, and how you have contributed to the scientific community. So only two questions. If using tables from an article, is it mandatory to get permission, or if we use and cite, is it enough? So for tables or particular diagrams or images, always it is better to get permission before reproducing or reproduction. So in those articles itself, it will be mentioned that it should be for non-commercial use, and mandatory permission should be taken for reproduction. If it is mentioned, then you are supposed to definitely take permission. Plain citation is not enough. Okay, yeah, because otherwise everyone will copy paste and they will just cite. So you are supposed to take permission from that, because usually people take images, like images of histology, or images of patients, or different kinds of presentations and all, clinical images. So there also you have to take permission. It is not enough just to cite. You are supposed to take permission. So only these three questions are there, ma'am. Thank you.
Thank you, sir. Over to you, Madhu.
Yes, ma'am. I think
you can introduce Radha, madam.
Yes, ma'am. So it is my pleasure to introduce our dearest Radha Madhavi, ma'am, who's the founder president of Tiruvannamalai OG Society. She is the director of Ram Multispecialty Hospital and Rajam Institute of Paramedical Sciences. Ma'am is a joint secretary and executive council member of TNFOG. She is a member of ISAR and IMS, and she's conducted conducted 2 annual conferences. That's the GestaCon in 2017-18 at Tiruvannamalai Medical College. So it is a pleasure to have you with us here, ma'am. Always smiling and always encouraging and inspiring all of us. So I request you to introduce. Ma'am, I think Sampath ma'am is not yet joined.
Sampath ma'am is not there. Ramani ma'am will talk,
Ramani
or Ramani ma'am?
Yes, ma'am. I'll just call ma'am.
Ma'am is not there. We can go to Dr. Anureka ma'am. We can.
Anureka ma'am is muted.
Muted.
I'm
Because
here,
Ramani
I'm
ma'am
here.
is not there. 1 second, I'll call her, ma'am. I'll call ma'am.
How I wish Parthasarathis article, Parthasarathis talk was there in my PG days.
It's really so interesting, ma'am. Learned a lot, seriously.
It would have been easier to make our thesis.
And sir had demonstrated each step so clearly and patiently.
Exactly. Exactly.
Yes. Ramani ma'am has joined.
Yeah, no, I just had a phone call. That's why I went outside. What, Sagiti? I'm supposed to do the next talk?
Yes, ma'am. Sampath ma'am is not there. You can finish.
Okay, okay.
I'll introduce you. Shall I
Okay,
introduce Ramani ma'am? Ramani Dev madam is the president TNFOG, national vice president.
Radha, don't waste time. Don't waste time.
Okay.
Just
Ramani madam is all in TNFOG.
No, nothing. I'll start sharing my screen. See, the topic given to me, or rather what I chose was rejected, don't stop it. So any article, it's very common for the articles to get rejected. That too, especially when you are in the beginning stage of your authorship, many of the articles get rejected. But we should not get depressed, and we should not stop it also. So you must understand why your article or manuscript has got rejected. So the common errors are that can lead to some of the that manuscript being rejected. They are, if you have written your research manuscript with the diligence and now you are ready to submit it for publication, you are actually worried whether it will get accepted or rejected. This is a common novice research scientist. However, if you know that what makes the journal editors reject your manuscript, you can take care of such errors before you submit. So the most important thing is when you plan to, so far everybody has been telling about how to write a manuscript and how to take the references and so on. Now, before sending it for publication to any of the journals, first we must go through the instruction to the author, and you must make your article to that of to the requirement of that particular journal. So it is not uncommon for any article to get rejected, and everyone has gone through the phase of it. And it was in one study that showed 62% of the published papers have been rejected at least once. But you see, in most of the studies, at least 50% of the rejected manuscripts were published within 2 years. That means your choosing the journal would have been wrong, or there should be something in the article that has made the particular editor decline that, reject that manuscript. So you would have probably corrected that. Okay. Then the rejection rates of top tier journal varies between 80 to 85%. Some journals have reported it to be around 90 to 95%. To me being the editorial board team of this Jogi, you know how many percentage of the articles get rejected? There are more than thousands of articles which are received by Jogi in a year, but the number of published or the articles that have been accepted for publication is only 100. So that means 90% of the articles get rejected. See, basically the national corresponding editors, what we do in that particular journal is we go through the abstract and we make a stringent decision whether to send it for peer reviewing or we can reject it at the base level itself. Suppose in the base level itself, if it is rejected, then the authors, what they do is they can send it to other people without other journals without wasting much of the time. And also it prevents the peer reviewers getting unnecessarily loaded with the articles. So the most common reason for journal rejection is even the researchers at the top of their field have experienced such rejection. There are several peer-reviewed studies have investigated the reasons why these journals get reject a paper. Listed in the next few slides are some of the most important causes for rejection. First hurdle is the technical scrutiny. Authors need to comply with all the requirements of that particular journal and submit all the supporting documents. That is what I said before sending the manuscript to any journal, you go through the author instructions and you fulfill that. Then only you send it. See, for example, the editors initially, they look at the title and the subject on which the research has been based. When it is not of much interest to the readership, paper can be directly rejected at the level of the editorial discussion. This is what I said. The national corresponding editors of Jogi, we decline, we do not reject the articles. We reject the article just looking at the content and the abstract. If it is not appropriate for that particular time of publication, maybe we can reject it. Such a paper may not be sent for peer review. That is what we are doing. So peer review, only those papers that withstand the initial editorial scrutiny are then sent for reviewer's opinion for detailed analysis. This reduces the burden of the paper on the reviewers. Hence, editors and expert reviewers can focus and give time to the detailed critical analysis of good quality paper. Then, what are the flaws due to the manuscript? The results are that they are not generalizable. Use of methods that have become obsolete because of newer technologies or techniques. For example, if you see that in a gestational diabetic patient itself, now we have the newer technologies like continuous glucose monitoring, or we go for the 7-point management. Instead of that, if you are going at the urine examination for sugar, that may not be appropriate. Or even the repeated sampling of this blood sugars, taking from the intravenous blood sugars, that may not also be suitable for the current time. Then the secondary analysis that extend or replicate published findings without adding substantial knowledge. Then studies that report already known knowledge, but positions of the knowledge as novel by extending it into a new geography, population, or cultural setting. See, yesterday they have been discussing that it is not it is all right if you take a known subject or a known topic, but you can modify it, that known topic from one place. For example, it is from Bangladesh to Indian context. We can go do it. So that is also an acceptable one. But the results that are unoriginal, predictable, or trivial, or have no clinical, theoretical, or practical implications can get rejected. And there is another thing is, most important thing is lack of originality, novelty, or significance. New York Times recognized the truth that journal editors typically prefer to publish groundbreaking newer research. Academic journals are constantly in lookout for the research that is existing and fresh. See, for example, you would have seen during the time of COVID, all the journals were just pumping in articles concerned with COVID. Like example, COVID in pregnancy and what was the effect of COVID upon the respiratory system and effect upon the cardiac system. So that like that, they were concentrating mainly on the COVID and its consequences. Many authors tend to cite the reason that this had never been studied before to explain why their paper is significant. Authors should give specific reasons why the research is important. For example, the research could affect a particular medical intervention. It could have a breaking on the specific policy decision, or it could change a conventional theory or belief. For example, if you are going to have a newer, say in endometriosis, what so far we have been taught is, unless we have a histopathological diagnosis for endometriosis, we are not supposed to start the treatment. But the current concept has changed, even with just a simple symptoms what the patient has, and the clinical evidence and the imaging modalities, non-invasive imaging modalities are sufficient without any histopathological or invasive type of diagnosis is needed for the starting the treatment. Then how to identify the hot topics? That is, read the literature, particularly the top trial journals, to identify what is the hot and new topic. Read letters to the editors to see the conversations in your field. Look for the controversies and unexplained things. Look over crossovers from other fields of research. For example, new methods that might be connected to old problems. And do keyword database searches to see volume and impact of the recent research in an area. That is what beautifully Dr. Parthasarathy has explained, how to go for a database search yesterday. So then do not waste time on dead or dying topics. For suppose if you take references that are 10 years old, it is a dead issue. There is no meaning in going through that. If the most recent references closely related to your paper are just 5 years old, it is again a dying issue. It is difficult for the editor to find suitable referees for the outdated topics. That is also one thing. For the outdated topics, the referees may not be aware of that, and hence they may not be able to do a peer reviewing. Then your inability to find enough references indicates that you have not done a good literature search. It is not an area of current interest, and others are not interested in the topic, so it is unlikely to be published. So the main idea is the editorial board team would love to publish any article that is of current interest and that is of searched more in the literature. So now there are certain reasons for rejection. That can be poor methodology, similar papers, case reports that are not rare or rare, plagiarism, high index of plagiarism, conflict of interest, and no new information in that particular topic, out of scope for journal, ethical issues, poor statistics, poor scientific content, poor language, poor references, then tall claim, and then case report of low priority, incomplete data, and revision is not good, and author's issue. These are all some of the reasons for rejection. So selection of the wrong journal. This is, I told earlier. For example, if your articles or the manuscript gets rejected from a particular journal, probably if you are sending the case report, the journal is not a type where it will accept case reports, then your paper manuscript would not have been accepted. And again and again, we have to read the scope of the journal and its home page and also the section on instruction to authors. search for similar articles, like similar articles in the same journal, see how they have done in earlier topics were done, and you can make use of those articles to publish similar articles of various topics in the same journal. Then mismatch with the journal. This is what I said. The area of interest to a very narrow or a specialized audience that the journal does not cater that specifically. Manuscripts that lie outside the stated aims and scope of the journal. Topics that are not of interest to the journal's readership. For example, case reports subjected to a journal that explicitly stated doesn't publish case reports. Then mismatch with the journal. Many manuscripts are rejected outright by the journals because before they even undergo review, because of the manuscript is not appropriate for the journal's readership or does not fit into the journal's aims and scope. The remedy is for this simple: spend some time creating a list of journals and reviewing your options before deciding to which journal you should submit your manuscript. Flaws in the study design. These can also happen in the early phase when you start writing. For example, poorly formulated research question. The research question that is being formulated should be of high quality. Poor conceptualization of the approach to the answering the research question, choice of weak or unreliable method, and choice of an incorrect method or a model that is not suitable for that particular problem that has to be studied. Inappropriate statistical analysis, that also yesterday beautifully Dr. Patsarji has given a detailed data. Unreliable or incomplete data, and inappropriate or suboptimal instrumentation, small or inappropriately chosen sample. The sample size what we are going to choose has to be calculated properly with the statistics base, and we need to have a sufficient number of samples to bring about the results. Then again, even a well-written paper will not mask the flaws in the study design. If the study design is not proper, even whatever be the beautiful English you are going to write, it is not going to help. Indeed, this is a fundamental problem that must be resolved in the initial stages of the study while conceptualizing the study. The best way to guard against such flaws is to do a thorough literature review to determine the best methodologies and practices for your own research. So that is the most important. Before you choose a topic, you have to understand, you have to have a thorough literature search and then go into the depth of the methodology, what you are planning, and then compare it to what is given in the literature, and then you modify your methodology. Poor writing and organization. Inadequate description of the method. Discussion that only repeats the results but does not interpret them. Insufficient explanation of the rationale for the study. Insufficient literature review, and conclusions that do not appear to be supported by the study data. This is also one important thing. See, when you write the conclusion, you must see to that what is your aim that should be answered in the conclusion. Then again, failure to place the study as a broad context. Introduction that does not establish the background of the problem that has to be studied. For example, if you are going to have a topic on medical management of endometriosis, if the introduction says only the general aspect of endometriosis and broadly the management, it is not an ideal one. So you are not focusing in that introduction towards the medical management. Such things should not happen. It is very important for authors to present a persuasive and rational argument in that paper. You should be able to convince the readers that your research is both sound and important through your writing. Then inadequate preparation of the manuscript. Failure to follow the journal's instruction. That is the first thing. Repeatedly, we have to go through the instructions for the authors and then write it accordingly. Sentences that are not clear or concise, and sometimes they tend to write a very long sentences that are not advisable. You need to write a crisp, short sentences that are very clear and concise. Don't try to use some jargon, this very difficult wordings, so that it will not be understood by the people who are going to study them. Title, abstract, or cover letter that are not persuasive. Then word and exclusive use of this jargon things should be avoided. Then large number of careless errors like poor grammar or spelling mistakes and poorly designed tables and figures have to be avoided. Sometimes what happens is the author's instruction will give you the tables and the figures should be given at the end of the topic, written topic. But if it is not done properly, then it can be a reason for rejection. Then again, non-English speaking authors often confront an additional problem. Suppose if the peer reviewer is a person who doesn't know English, they cannot distribute, the peer reviewers do not always distinguish between the manuscript content and the style of writing. Thus, their manuscripts may end up getting negative comments even if the research is of high quality. However, all the problems in this category are easily fixable either by asking a native English-speaking friend or a colleague to review the paper or by getting the paper professionally edited and formatted. Then false finding in the research results. Journals accept only those manuscripts that presents an original research study, those which report high quality and novel work and make significant contributions of their desired field. Thus, if your manuscript fails to meet the criteria or it reports a routine or a trivial or a false finding which does not contribute significantly to the progress of science, it will be outwardly rejected. So then comes plagiarism. See here, the plagiarism, what is self-plagiarism? That is reproducing your own work in another journal without citing the original can lead to rejection of your manuscript. Therefore, you should always acknowledge your sources of references, not submit the results of the published literature even in a lower ranked journal. Change the text copied from another source to make it different and also acknowledge the source. So when you are copying one sentence from one source to yours, then it is always preferable to change the text format, change the wording, but giving the same meaning. So that will be acceptable to avoid plagiarism. Then ethical committee issues for rejection. Ethical committee permission when it is not taken in needed cases, informed consent of the subjects are not taken, and conflict of interest is not declared. These are some of the issues for rejection. Then how to avoid rejection? Search the published literature related to your research topic and see the results. Publish only those findings which are new or significant to your field of research and highlight the novel properties in your research study. See, if it is going to be a newer modality of diagnosis, then you have to highlight upon that and then compare your article with the previous work in the field and justify that you have made some improvements in that particular research work by a clear statement. So then technical errors. Discrepancy between the abstract and the remaining manuscript. Study of the wrong groups, wrong statistic. That has been described yesterday. For each type of study, we have to select the appropriate statistic method. Otherwise, it will be a waste. Clinically insignificant results, absence of a relation between results and the discussion, contradictory or false data. It is never give any false data to your research work. If the conclusion does not answer the research question, poor use of language with grammar, spelling, and punctuation errors, that all those things are technical errors. Now, failure to follow instructions to the authors. If you do not follow that as prescribed by the specific journal, it will either delay the peer review process or lead to manuscript rejection. So you should always carefully read that instruction n number of times. Best take a printout of the journal guideline and highlight the key instructions what you have to follow. Before submission, you check all whatever the instruction given has been appropriately filled up. If you do not understand the instructions or short of time, take the help from the professional scientific editors who are available currently. Editor language in a conditional rejection. That is, it can be either frankly, the rejection will be stating that is unacceptable in the current form for publication. That means it is not suitable for that journal, and you need to have a major revision and send it to some other journal. Then the second one will be, they will be writing it as, it will require major revisions. Would be more suitable as a brief report. Then this paper, while of interest, needs to be completely restructured. So then the reviewers have raised serious concerns that need to be addressed. So manuscript would need to be revised to comply with the requirements of that particular journal. So rejection reasons are not related to the manuscript quality always. The low quality of the manuscript is not always the reason, but sometimes it could be the space constraints in that particular journal. For example, take Jogi. Jogi can accommodate only 100 topics in an year, but there are lots, more than thousands of articles, manuscripts that are being sent to the Jogi. So because of the space constraint, even second best papers would not have been accepted and it would have been rejected. Then quality and the experience of the peer reviewers. What one peer reviewer, the senior reviewer may think good for publication, a junior reviewer can think that it is good for publication. It may be a different thing from the senior peer reviewer. Then volume, that is what, and higher the number of submissions to that particular journal, higher will be the rate of rejection. Then journal's decision-making policy is one more important thing. And the journal editor is looking for something specific at a particular time. So the most thing is, if there is a sort of you have higher number of patients with malarial disease or something at that particular time, if you get a different topic, the editor may prefer the malarial thing to that of the other topic. So it depends upon the time at which the publication is sent for publication. Journal receives more than one submission on the same topic. The journal peer reviewer may automatically choose the one topic that is the best. Then quality and experience of the peer reviewers. That is also very important. The quality of peer reviewer varies widely according to the reviewers' professional experience, educational background, research interest. That is what I said. A senior reviewer, his view may be different from a junior reviewer. Then again, volume also, I have the volume of submission. If it is higher, the volume. See, for example, the Nature receives 10,000 submissions per year, making the rejection of even high quality manuscripts inevitably, because it can accept only less than 400 or 500 articles. The rejections that are again the journal's decision-making policy, that is very important. This varies widely among the journals. For example, some journals follow the policy of rejecting any manuscript that will require major revision. So they will clearly say that it needs a major revision, hence it may not be acceptable for publication. But while some journals may complete, they might ask for another, send it to another peer reviewer, and they can have some, they allow the author to make some sort of revision. So then the journal editor is looking for something specific at that particular time. And sometimes the journal editors may wish to publish the thematic issue. For example, if you say that particular journal for that issue is only on fibroids, probably the articles that are fibroids may be accepted earlier than that of the other article. Journal receives more than one submission on the same topic, that I have already explained. So now send the paper back out, submit the paper to another journal within a month. Don't wait for a longer time. Suppose if you take around more than 1 year, the topic what you have written may not be appropriate for the next time. And suppose if your paper gets rejected 4 times, better you understand there is a serious flaw in the paper and you have to find it out, and you need, probably you cannot send it for any further, and we cannot make it for more and more of correction. So to conclude, poor experimental designs and inadequate investigation, failure to confirm the targeted journal, poor English grammar, style and syntax, insufficient problem statement, methods not described in detail, over-interpretation of the result, and then inappropriate or incomplete statistics, unsatisfactory or confusing presentation of the data in tables and figures, conclusion not supported by data, incomplete, inaccurate or outdated review of literature. So always when you take into the review of literature, take the last 5 years. Then if you have more number of review of literature evidence for the past 2 or 3 years, you try to take it up. Do not take anything beyond 5 years retrospectively. Author unwilling to revise the manuscript to address the reviewer's suggestion. And then there are so many reasons that journals reject manuscripts, some due to the quality of research or manuscript, and some due to completely avoidable reasons like mismatch with the journal. Further, it is not rare for the journal to reject even high quality because of the space constraint. The reasons given above are some of the most common reasons for rejection but they are not the only ones. Other reasons include salami publication, non-conformance to ethics policies, and plagiarism. So thank you for all the people who are listening patiently. Thank you.
Wonderful talk, madam.
Thank you, Radha. Anureka.
Yes, ma'am, it is very good, and you have taken some of my portions also on plagiarism and everything.
Okay. See, actually, what happened now? One of
Yes,
my
ma'am.
topics in my PhD thesis,
Okay.
some other journal had entirely published my own article that I have published in a different journal. So that was showing repeatedly plagiarism. Then
Yes, ma'am.
ultimately we found out.
Ma'am, we can, Uma Velmurugan ma'am not available. You can go to Anureka ma'am talk. And we
Okay.
just introduce.
Okay.
Sahiti, you're
Anureka
available?
is not a new person to our research methodology workshop, and she has did her master's from AIMS, DNB fellow in reproductive medicine. And
Ma'am, I think we'll move on, ma'am.
yes. Okay.
Yeah. No issues, ma'am. Thank you, ma'am. Yeah. Very good evening, ma'am. Very good evening to all. I'm talking on publication ethics. What is ethics? Well, when you talk of ethics, morality, you have to talk of immorality or something which is opposite to ethical and moral principles. Then only you can understand the ethics. So I'm going to talk on the things which are against the publication ethics. That is, what are all the scientific misdeeds and misconducts? So in that way, you can understand what is to be done and what is not to be done. Well, why we should teach the wrong things? This is one picture that made me think. This is one beautiful quote by Catherine Schultz. Our love of being right. Like nobody wants to get a bad name, right? Everybody wants to get reputation. So our love of being right is best understood as fear of being wrong. So you don't want to be wrong. So that is why we have to be right and we want to be right. So that's a basic idea behind this topic of publication ethics. So I'm going to talk within my stipulated time on these topics, like what are all the research misconduct, what is FFP, and research practice misconduct, and what are all the ethical principles, and publication related misconduct, who are ghost guest authors, what is salami slicing, and data related misconduct, and personal misconduct, and financial and other misconduct. So what is research misconduct? The first is a research misconduct, that is FFP. What is research misconduct? The misbehaviors by the scientists can be labeled as misconduct. And in short, the US Federation policy has three forms of research misconduct, like the plagiarism, fabrication, and falsification. So whenever there is something wrongly proposed, or a research has been wrongly performed, or a research is not done and the results has been published. So these includes the fabrication and falsification, and basically the most crucial forms of misconduct. And plagiarism, ma'am has already dealt with, but I'm going to deal it in detail also in the later slides. And the World Association of Medical Editors, WAME, and the US Office of Research Integrity has classified 10 types of scientific misconduct or misdeeds. Well, the most important one, that is the fabrication, falsification, and plagiarism. It normally includes selectively excluding the data from analysis. Like you do have a data, but you know that this data will influence your results and you want to exclude it. So this is wrong. So this is fabrication of data and misinterpreting the data to obtain the desired results, including the inappropriate use of statistical methods. Like you do have one method of analysis, statistical analysis, in which you get a significant or a more significant or closer to significant results, and you are proposing that one instead of the standard. So that is a misinterpretation, and that is a misconduct. And doctoring the images in publication. Like you do have an image and you want to show a before and after image, for example. And after image has been a doctored image or you have modified it. So that's a misconduct. And producing a false data results under pressure from a sponsor, maybe a sponsor of a drug or a sponsor of a methodology which has been used for investigation, whatever it is. So these are all basic types of misconduct which comes under FFP, that is fabrication, falsification, and plagiarism. Fabrication, that is the making of the data, results, and recording or reporting from a non-existent study. So this is one example. Somebody is completing a questionnaire for a fictitious subject. The subject was not there. The person was not interviewed. And somebody has completed the questionnaire and doing a publication or publishing it in a manner in such a way that it influences the daily practice. So that's fabrication. Or creating a data for an experiment which was never conducted, or an adding of data to a real data set. Somebody has done some 10 samples and they're doing it for 50 or 100 or something like that. So that all comes under fabrication. So this is one example of falsification. What is falsification? Falsification is manipulating the research materials, like changing or omitting data, and includes a selective omission or deletion or suppression of a conflicting data. So this is one example. Andrew Wakefield. This was a person who was a physician. He was a researcher and he has published in around 1970s in a matter relating to MMR vaccine and autism in children who have been vaccinated. And this was based on a very small scale study, and this was very notorious, and it influenced the vaccination with MMR in such a way that the people almost stopped vaccinating with MMR vaccine. And later on, almost 20 years later, in 1998, this was revealed in Lancet, and that was a very significant landmark in a clinical history, and that led to the reawakening interest on MMR vaccine. So this is one example of falsification. And falsification may also include altering the data and misrepresenting the results from statistical analysis, and misrepresenting the methods of an experiment, and adding a false or misleading data statements in the manuscript, and falsifying the research accomplishments by publishing the same results in multiple papers. This is one form of self-plagiarism. So this is also a falsification. Same results which has been published in multiple papers. And misrepresenting the materials and methods of a study in a published paper. And providing false statements about the extent of your research study. Somebody has done a study and it has an acceptable bias and everything, but it is concealed, it is masked, like they have not revealed the extent of bias. That is also a falsification. And what is plagiarism? நம்ம தமிழ்ல சொல்ற மாதிரி ஈயடிச்சன் காப்பி, in simple words. And there are different types of plagiarism: complete plagiarism, direct plagiarism, paraphrasing plagiarism, self-plagiarism, patchwork plagiarism, source-based plagiarism, accidental plagiarism. Well, we'll come to all these terms. And self-plagiarism, I earlier mentioned in my slide, like 2-3 slides back. It is having somebody's own work copied in some other publications, like one publication of yours or somebody else, and you are doing it for your own sake in some other publication. Like you're using your own words. That is also a plagiarism. That is self-plagiarism. And complete plagiarism. Okay, what is complete plagiarism? Everybody knows that it is just to steal somebody else's work in toto. Okay, and direct plagiarism is also a similar one, in which there is a direct copying of the phrase-to-phrase words in somebody else's publication. And paraphrasing plagiarism, like if you want to change the words, somebody has published a result or some data, and you're just changing the words and doing it in your paper or article. So that is also a plagiarism. That is paraphrasing plagiarism. And patchwork plagiarism, somebody has done a part of the work, somebody has copied on a part of the work and utilized it for their own publication. And source-based plagiarism, like this, for an example, a company has sponsored 2 studies. Okay, and these 2 studies have almost similar results and almost similar thing. So like the patient has been included in both the studies are the same. So this is source-based plagiarism. And accidental plagiarism, well, it is a very rare one, and two different persons thinking alike who are staying in different parts of the world thinking alike, they do have similar words which has been published. So that is an accidental plagiarism, which is very rare. Okay, so nowadays there are a lot of softwares to check in this plagiarism. So this is one Turnitin, which is a software, and also a plagiarism checker, which is freely available online. And in that, like after your article is done, after your paper is done, you can just copy paste your article for a publication in a Word document format or something like that. And this will give you the result like 70%, 60%, or whatever it is. Okay. And most of the publications accept 15 to 20% plagiarism. So if it is less than that, you are not going to have a big deal. Okay. And I'm now moving on to the next misconduct, that is research practice misconduct. Okay. So suppose if you are doing a research and the research is going to be a harmful or dangerous one for the subjects who are undergoing the study. So that is a misconduct. So using an inappropriate method, like if you know that the treatment is going to be the method or the drug which is employed is going to be a dangerous one for the subjects employed. So that is a misconduct, which is a serious misconduct. And also, if the research design is poor, like there is a proven benefit of the treatment, and you're going to do an experimental or an analytical study or a randomized controlled trial in which you employ a placebo. You know that the treatment is going to be of a proven benefit, but you employ a placebo. That is also a misconduct. Instead, you can use a different form of treatment method, which is of lesser benefit or nearly equal benefit or something like that. But if you're using a placebo with an established treatment arm, that is also a research practice misconduct. And in everywhere, the violation of human subject protocols or the abuse of laboratory animals is prohibited. And ethically, it should be an acceptable one if you employ human subject or any lab animals or any living beings, and for that sake. And if there is a violation of these protocols, it is seriously prohibited. So the research should be ethical. So it should add to the existing information. And if the humans are involved, there should be a proper consent and information sheet. And also the privacy and confidentiality matters has to be taken into account. And the animal studies too involves a proper permission from, like we do have a Blue Cross permission for certain animal studies. And there is and also there should be a proven authorship roles. Like if the first author has been assigned some role, that has to be mentioned in your publication, like the research modification or the data planning or data collection, or somebody has done the manuscript. So you have to give the roles assigned to each authors in clear format in your publication. And if there are any conflicts of interest, it should be declared. And there are certain guidelines which are regulating this ethical practice of publication. There are some international standard of ethics, and these ethical things are also applicable for the questionnaires form of study in the aspect of protection of privacy. Like if you provide a questionnaire and you're doing a data collection and you're doing a study, the questionnaire should be concealed of the person who has filled the questionnaire. Like you can remove, or you can keep 2 pages of the questionnaire. Like the first page will be the information part of the subject involved, and the second page will be the questionnaire. So there should be a protection of privacy even in a questionnaire form of studies. And this is some various guidance documents which are internationally recognized for the practice of ethics in biomedical research. In 1947, the first one, the Nuremberg Code, came into existence. That initiated the discussion on rationale and justification of the research risk-benefit analysis. And then came the 1964 Helsinki Declaration, which was revised later on, 2013. Later on also it is revised in 2021. This has a commitment to the individual rights to make informed decisions and investigators' duties and research participants' welfare and vulnerability. And there is a Belmont report of 78-79 describing the basic ethical principles of autonomy, justice, and beneficence. And 92-93 SIOMS guidelines. SIOMS is nothing but Council for International Organization on Medical Sciences and WHO. This is last revised in 2022. This is basically dealing with the principle of pharmacovigilance. And one another good clinical practice guidelines by 1996 International Council of Harmonization were also in place. So these are documents which are available over online in free. Just you can type like Nuremberg Code. The PDF format will be open in web, and you can just go through it if you're doing any studies of a questionable ethical practice. And this is our national guidelines, ICMR National Ethical Guidelines. This covers, this has around some 200 to 300 pages of booklet. This covers all the guidelines related to research methodology, consent, and waiver of consent and its applicability, and the organization of institutional ethical committee in the local place. An institutional ethical committee or an institutional animal care and use committee approval is a must wherever a human being or an animal study has been conducted. And Clinical Trial Registry of India, CTRI, is an overall trial registry. A person doing study in India is supposed to register his or her trial in the CTRI, which will give you all the standard standard format, and all your specifications of that particular study has to be met if your study has to be published. I mean, if your study has to be registered in CTRI, and this plays a role in your publication. If one study is a CTRI registered one, it has an advantage over some other study for a publication in a reputed journal. An Indian Journal of Medical Ethics, it is a journal published by the Forum of Medical Ethics Society. This is being published since 1993. And this has given a very detailed information on the ethical considerations. And this is one quote which I made is in volume 11 of 2003. This is ethical consideration in medical photography, which is to be followed for photographing a subject with a disease or somebody. And this is one CTRI registration of my own study in 2019. And next, moving on to the publication related misconduct. If somebody is claiming an authorship, that is also a misconduct. Or somebody has valid reason for an authorship, but he has been denied of an authorship, that is also a misconduct. And what is salami slicing? Artificially proliferating publications. Like there is one study which is being done, but there are numerous publications which is based on the same single study. So that is called salami slicing. I'll be coming in detail. And if there is a failure of proof, whatever you have done, you have a study, you should have the master sheet or a soft copy, and you should have all the relevant hard copies like the consent and data analysis. And if a questionnaire is being used, the questionnaire should be preserved. So that is publication records preservation. If that is a failure to give the proof of study or the preserved publication record, then that is also a publication related misconduct. And authorship rules, there should be a substantial contribution of each of the author, like the concept or the design of the work, or an analysis or interpretation of the data, or the drafting of the work, or revising it, or critically appraising it, or the final approval of the version is being done by that particular author. Okay, so all should be there if that person has to be given an authorship role. And also, there should be an agreement to be accountable. Like if somebody has been given an authorship and that work is being sued for some other reasons, everybody, including first author, second author, or whatever, third, fourth, fifth, all the authors are accountable for all the aspects of the work which is published. Okay, so they should be ensured that the questions related to the accuracy or integrity of any part of the work is investigated and resolved, and there is no dispute among the authors in such questionable things. And this is one example of ghost, and this is one publication stating ghost and guest authors. So if you read an article and there are some 3 or 4 authors in it, like as I said, these are the authorship rules which has to be stated, which has to be put in dicta in that concerned publication. And if suppose if a person was not related to that particular study in any way, has been given an authorship, that's a publication related misconduct. And this is when Journal of Pain Medicine in 2015 was given a nice article on ghost and guest tablets. And this is salami slicing. The slicing, it is similar to slicing of meat, which is shown in the picture. Okay, so as I said, somebody is doing one study and they've done numerous publications based on the same study. So that is a misconduct. That is salami slicing, and that is to be avoided in all the possibility. And data related misconduct, it is similar to preservation of primary data has not been done, or the data management has not been done in a proper way, or it has not been stored, and the data has been abstained from scientific community. Like suppose if somebody publishes an article, and that article is being taken for a Cochrane review, and that Cochrane review Cochrane review wants that original data which is being collected in that article. So that data has to be provided for that particular review. Okay, so if that data is not provided, that is a data related misconduct. And what is personal misconduct? Inappropriate personal behavior, or a harassment, which is inadequate leadership or a mentoring or counseling of students, and insensitivity to the social or cultural norms. Like suppose if you want to analyze the effect of Gurkha in a patient, effect of effect of covering their head and effect of Gurkha in a population where there is predominantly Muslims. Okay, so that study is going to affect the local social and cultural norm, and that study is going to really take a cautious reviews from that particular people. So that has to be avoided always. And financial and other misconduct, peer review abuse, like non-disclosure of the conflict of interest, or unfairly holding up a rival's publication. Somebody is reviewing it, and they personally they don't want that author to have the publication. So that is also a misconduct. And misrepresenting the credentials or the publication record, or a misuse of the research funds for unauthorized purchases, or making an unsubstantiated or malicious misconduct allegation. So all these are misconducts in miscellaneous ways. So this is one software published or perish software. This is also available online, but you have to subscribe it. You are supposed to pay a certain amount of cost every year or every month or something like that. And this will give you an easier way, like as Dr. Pathasarathi was saying about the Jotiro software. This is a software to look into your manuscript and to look for any evidence of misconducts or evidence of plagiarisms which has been there. So in a toto, you can just copy paste your work, and it is also a helpful one to ease your work for publication. This is one software, and I end my talk with one Tirukkural quote. எல்லாமை வேண்டுவான் என்பான் எனைத்தொன்றும் கல்லாமை காக்கதன் நெஞ்சு. எல்லாமை வேண்டுவான் என்பான் எனைத்தொன்றும் கல்லாமை காக்கதன் நெஞ்சு. அப்படின்னா எல்லாமே அப்படின்னா நம்ம எப்பவுமே நம்மள யாருமே குறை சொல்லக்கூடாது அப்படின்னு நினைக்கிறது. அதாவது எல்லாமே வேண்டுவான், குறை சொல்லக்கூடாதுன்னு நினைக்கிறவன் என்பான், அவன் யாரு அப்படின்னா எனை தோன்றும் என்னைக்குமே கல்லாமை காக்கதன் நெஞ்சு. அதாவது வேற எதையாவது ஒண்ணு திருடக்கூடாது அப்படின்னு திருடுறதுங்கிறத மனசளவு கூட நினைக்காத நெஞ்சு உடையவன் தான் அந்த மாதிரி இருக்க முடியும் அப்படின்னு சொல்றாங்க. அதாவது எல்லாமே வேண்டுவான் என்பான் எனை தோன்றும் கல்லாமை காக்கதன் நெஞ்சு. விளக்கம் என்னன்னா, எந்த பொருளையும் களவாடும் நினைவு தன் நெஞ்சை அணுகாமல் பார்த்து கொள்பவரே இகழ்ச்சிக்கு ஆட்படாமல் வாழ முடியும். So அதாவது நம்மளோட publication misdeeds is one form of it, which is represented by Tiruvalluvar in this Tirukkural. So that's why I wanted to quote this. And there is no shortcuts in anything, and just you have to do your hard work, and just you have to work every day and each day for your success. That is what I would recommend everybody. Thank you. Thanks for your patient attention.
Thank you, ma'am. So I think, ma'am, next Chitra ma'am and Sampath ma'am are yet to join, ma'am. That was really a very interesting and very clear talk, ma'am. Ma'am, sometimes, like, suppose in case if we are dealing with a retrospective study, like we take back old case sheets and if we are seeing, and we want to publish data from that, then for ethical clearance, what do we do?
So you don't have to have an ethical clearance for retrospective study, but waiver of consent and waiver of ethical clearance. Like you can just mention that this is the retrospective study using only the data of all those patients who have been visited to our hospital, and we have nowhere revealed the privacy or the confidentiality of the patients. So we have to put it in statement. One thing, and second is you have to mention that waiver of consent has been given by the local institutional ethics committee.
Okay,
So
local
you mentioned that waiver of consent has been obtained from the local institutional ethical committee.
Okay,
But
okay.
Anureka and
Ma'am,
Madhumita,
சொல்லுங்க,
I
ma'am.
think it's always better to have the consent from the patient. Like
Yes, ma'am.
what I do is, when we get the consent for surgery, I take the consent from the patient that your data may be utilized even for a prospective or a retrospective study. Save our skin.
Yes, ma'am.
Okay, okay.
I think the last doctor, what happened to Dr. Chitra? Chitra,
Sampath,
madam, is she there?
Yeah, ரெண்டு பேரும் ஜாயின் பண்றாங்க மேம். Yeah, joining. 2 minutes.
யாராவது ஒருத்தர் ஃபர்ஸ்ட் பேச சொல்லிடுங்க.
Madhu, shall I call Sampath, ma'am?
No, ma'am, I'm calling. Call பண்றேன் ma'am.
Ma'am, when you're submitting an article to Jogi, no, ma'am, in that when we're submitting, in case if it is a short commentary article like that, in that, for commentary article also, in the abstract itself, should we give the references or only after the abstract is accepted during the...
After accepting the abstract only, it is, you need to give the references.
References, okay.
But it will be filtered by the corresponding editors. If it is up to the mark only, we will forward it to the peer reviewers.
Okay.
They are very particular. They have given certain, the editors have given a certain instructions to how to choose this topics.
Okay. Yes, thank you.
Sampath, good evening. Good evening.
Ma'am, Sujata ma'am joined, ma'am. Chairperson Dr. Sujata ma'am.
Chairperson, Dr. Sujata, good evening.
Good evening, madam. Good evening, madam.
Welcome.
Sujata ma'am, Ramani ma'am பேசி முடிச்சிட்டாங்க. Sampath ma'am தான், I'll share the CV also ma'am.
Sampath and TV Chitra, இன்னும் 2 பேர் தான் இருக்கு.
Ramani ma'am, kindly introduce.
Yeah, I am happy to introduce Dr. Sujata Alagation, who is the professor of obstetrics and gynecology department of Tirunelveli Medical College. She is the president of, don't write it as Foxy Tirunelveli currently. You should write it at Obstetric Gynec Society of Tirunelveli. Conducted live obstetric and gynec workshop. Sorry for telling it because otherwise I will forget. That's why. Then presented 5 national papers, best paper award in FIVA Foxy, national faculty in AICOG twice. With this, I request Dr. Sujata Alagation to take over the chairpersonship for Dr. Sampath's talk.
Madam, it's a very
you can
good
introduce
for
Dr.
all.
Sampath.
Okay, madam. It's madam, am I audible?
Yes, you are audible very well.
The Dr. Sampath, madam, we know her for a long time, madam. When we are working in, she was in the government service. We used to go together for all the counselings, etc. She is very friendly and very down to earth, and she needs no introduction. And she is known well all over Tamil Nadu and now all India also. So she has been the Foxy Vice President, Senate member, and National Corresponding Editor, Founder Secretary for the Tamil Nadu Federation of Obstetrics and Gynecology. She has been the President for Board of Studies of OG Tamil Nadu Medical Engineer University, Chairperson for the Foxy Adolescent Health Committee, which is a very close topic, very interested topic to her mind for adolescent health. She has given very beautiful videos and a lot of teachings on that. It is impressive. and she was the first ICOG Distinguished CC Member Award in 2020-21, chairperson for the Women's Wing IMA Chennai, IMA for the National President Award, and IMA TNSB Award also. And lot more laurels to come to you, madam. Madam, we are eagerly waiting for you. Thank you, madam.
Thank you, Dr. Sujata, for the nice words. 1 minute, I will share the screen. Screen terida?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Yes.
Yes, ma'am.
Yes, good evening to all. First of all, I should thank our President, Dr. Ramani Madam, for organizing this wonderful research methodology workshop. But unfortunately, many people were not able to join. I think there are a lot of webinars and conferences. So thank you, Dr. Sujata and Dr. Madhumita, who is the coordinator for this program. So my topic is tips and tricks to publish a paper. See, always publishing a medical journal, that too the paper in an art, in a journal is, nowadays it's very, very difficult. Usually PC Mahabhatra sir used to tell, people who are working will not publish paper. People who are publishing will not work. But nowadays it's not like that. Everyone can do this publishing because whatever work you do, we need the documentation. So whatever statistics you have, it has to be published. So how to publish? See, publishing a research paper is a significant milestone for any researcher. If you want to publish a paper, means you have to think why we want to publish this, what is the necessity, what is the importance for you, how it will help the community, everything has to be known. So it allows to share findings with the academic community and contribute to the knowledge of the body of the knowledge in the field. See, if you publish now, for example, PPH, for postpartum hemorrhage. Now with the WHO and the FOXI, they are doing a emotive trial. See, I think many of the people may not be knowing what is the emotive trial. So we have to be in touch with the academic community such that what is the latest things, it will be useful for our daily practical life. So that you have to attend conferences and you have to read the papers, which is the recent published. That is very, very important. However, the process of getting a paper published can be daunting for many researchers. Many will be thinking, I want to publish the paper, but the journal is not accepting my paper. I don't know. I went to the other journal. There I have to publish with giving the money like that. So everyone, first it will be a difficult. Once you start publishing the papers and it will become use, even the 10 data, if you have, you will try to make other correlations and try to publish it. So to help guide you through this process, here are some tips and tricks. So how you can publish a paper? For this, some tips and tricks which I have given. See, first we want to know whether it has to be published in the international journal or it has to be published in the national journal or it has to be published in the local journal. So you have to select the journal, which journal you want to publish. See, before writing a paper, it is important to identify the most suitable journal for your research. See, now you are doing a research work or now you are want to publish a case of around 25 to 50 cases of PPH. What you did, whether it is a medical management or surgical management or mechanical management, that statistics and paper you cannot go and do in the journal which is not an OG journal. If you are going to publish in some SPM journal or some research journal, it may not be useful because the journal where the OGians, obstetrics and gynecologists, most of them, even in the private hospital, even in the village, whoever is able to read the journal only, your work will be useful. So first you should select the journal which will be useful for other obstetricians also. Consider the factors such as the scope of the journal and its readership and its impact factor. Now, if you consider on your point, nowadays, as per the latest NMC and MCI, you have to present papers. Then only you will be considered for the promotion of associate professor and from the associate professor to the professor. So for that, what is the journal is important. In the NMC, only some journals will be taken into account. Other journals may not be considered that you have published the paper. So after doing a heavy, long work that you have collected the data and you have they made ready the paper, and if you have published the journal which is not common and which is not accepted by the NMC, means it will not be useful for you for your promotion. So everything has to be needed. It should be useful to the other logicians, and it should be useful to you, and it should be useful to the community. By publishing this paper, what effect can to the community can happen? For example, during the COVID season, now we were talking about the Corona 2021. Finally, one day we came to know about the COVID vaccines, which was made compulsory in the India. And because of that, many people, we are able to reduce the mortality. So depending on the situations and depending on the environment, whatever is needed, that has to be published. Submitting your paper to a journal that is well respected in your field will increase your chances of the acceptance. So for a high quality medical journal, so now as far as we are known, now we have the Jogi and we have the British Medical Journal, we have the American Medical Journal. So how to select it? Select the appropriate journal and choose a topic that you are passionate about. See, now you are working for, see, if I am taking me itself, I am interested in doing the adolescent work. So I can do the paper publishing on adolescent PCOS, adolescent endometriosis, whatever the topic which is concerned with adolescents, because I have a lot of statistics and I am working on that. If I am going to publish a paper on infertility, which I am not at all doing, so it will not be correct. So if that is so that is the reason, whichever you are passionate, then you will have the interest and you can do that paper presentation, whatever field, even for if you don't have the cases, and even if you are in a primary health center, you can make some social example for adolescent and menopause. What are all the menopausal awareness symptoms? Whether they know about the heart flutters, whether they know about the dyspareunia. So what are all the menopausal symptoms? When the patient attained menopause, when she was, whether she was known about the awareness, whether she knows about the hormone replacement therapy, like that you can present. It doesn't mean that you have to present only the high-fi paper. Conduct a thorough research and draft a draft outline. So you do an outline. You take 100 menopausal patient and ask them the simple questionnaires in which the patient can understand. 100 questionnaire, and then you go to SPM department and make it a paper such that among the 100, only 50% knew that these are all the symptoms for the menopause, and only 20% are aware of the hormone replacement therapy, and only 20% know that if the lifestyle modification can also change the menopausal symptoms. So always rewrite and edit and then submit for the journal. So these are all the easy steps for your paper to get accepted. And follow the journal guidelines. If you are going to accept, apply to the Jogi, or if you are going to apply to the British Medical Journal, each journal will have some guidelines. They will take the references has to be written in the alphabetical order, or the references has to be written as 1, 2, 3. So read the guidelines of that journal, and according to that you present. Once you selected a journal, carefully review its submission guidelines and make sure to format your paper according to the journal requirement. Whether always all of you will be knowing about the abstract, and we are writing the thesis when we were doing the PG. More or less, it will be similar only, but small modification. So according to that particular journal guidelines, you write and make the paper. Failing to adhere to these guidelines will tell that this paper is rejected, or you have to do some review work like that. Without a rejection and without the review, if you want to do, means follow the particular journal's guidelines. So this is the work we have to do, how to get started, where we should say 100 cases means write what is the title and the abstract, introduction, methods, results, and then do the discussion, as I told, among the 100 menopause patients, what was the symptoms. And always, if you are going to write completely paragraph wise, no one will read. So it is better to make the tables and the figures, and finally you make the references. When you go for the references also, always you take the last 5-year references. Don't take the reference of 1980s and 1990s. Now it has almost updated and it has changed. So references should be within 5 to 6 years. And the authorship and the choice of the journal, submitting a paper, responding to the reviewers. Suppose if you are submitting the paper and the reviewer is giving some corrections, means you have to do the corrections. Then only it will be easier, and the reviewer will also be given importance, and your paper will also get modified. The abstract is the first thing that the editors whenever you submit the abstract, most of the times the reviewers, even the readers, everyone will first see the abstract only. If your abstract is very, very attractive, they will go and read the full content. If the abstract itself is not good, they may not read the article. So always be clear when you write about the abstract. That is very, very important. Clearly state the purpose of your research and your methods and your key findings in the concise manner. Suppose now we want to take an article to tell about the endometrial hyperplasia. Now you want to compare the peoples and the three methods, whatever methods, if you are doing the fractional curettage, or if you are doing the OP procedure, or if you are going for the hysteroscopic procedure, first you identify the methods. What are all the methods you are going to do? And what is the comparison, and what is the final conclusion, which method is easier, and which method gives good sensitivity and specificity. That has to be, you should be clear. And finally, you should come to the concise manner that OP procedure needs no admission, hysteroscopic procedure, no endometrial tissue will be left out. Like that, fractional curettage, that is the oldest procedure, everyone can do it. Like that, you should be clear with the subject, and the articles also should be clear what you want to tell. A well-written abstract can attract the attention of potential readers and increase the chances of paper being accepted. Nowadays, most of the time, all are worried whether my paper will get rejected, why it should get rejected. Even if it is getting rejected, correct whatever the advice given by the reviewer, and again, you apply to the same journal. Otherwise, you modify it, and then if this journal is not accepting, wait for a few months, and then you go for the other journal and read the rules of that journal and apply the article according to that journal. So, present the findings clearly. When writing a paper, make sure to present the findings clear and logical manner. How many peoples you did, how many fractional curettage you did, how many patients you did the hysteroscope. From the hysteroscope, how many endometrial CA you identified. From the peoples, how many hyperplasia you identified. From the fractional, what was whether it was a daycare procedure or whether it was an admission procedure. So everything should be clear. Use headings and subheadings to organize your content and provide sufficient details to support your conclusions. If reading your paper, they should also think, we can also present a paper like this. What is that? It is a simple and endometrial analysis. So we can also do from our places. If they are publishing 400 cases, means we can do at least 100 cases and see how many hyperplasia and how many of them are going for the endometrial cancer. So if it is clear and logical, everyone will like the paper and they will also try to do the articles. Make sure to explain your methodology and result in a way that is easy for the readers to understand. So you cannot go for a hi-fi. The SPM people will tell all the hi-fi words. You can tell whether it is a prospective study or retrospective study, cross-sectional study, or it is a case control study, or it is a case study. That's itself you can tell in a simple manner. So if the peer reviewer is telling that you have to take the references for the last 5 years only, and this language is not good, the language has to be modified. So if some opinion or questions are given by the peer reviewer, means you clarify that questions and again submit the articles. Then the reviewer comments. If your paper is sent out for peer review, be prepared for the feedback from the peer reviewers and take their comments seriously and use them to improve your paper. It is only the reviewer's opinion is we are improving our paper. That's all. Address each comment in a manner, providing additional data or clarification as needed. So the references may not be good. The references has to be added, or the recent references has to be done, and your material may not be sufficient. You would have taken only 10 scientific materials. So that statistics, if needed, that has to be improved. This will show the reviewers that you are responding to their feedback and committing to produce high quality research. See, similarly, depending on the time, see now if you are going to tell what is the complications of a COVID in pregnancy, means no one will like it, because in 2021 only COVID was there. Similarly, like this only, now this IPL, I think it is going very, very weak. Now all of them are talking about the chess champion. So what is the current need? According to that, you have to present the papers. So you should have the researchers. You should be in communications with the other people also, what they are writing, what the research they are doing. So building relationship with other researchers in your field can be beneficial when it comes to publishing your work. Now, suppose now you are doing, some cardiovascular disease, means you be in touch with the cardiologist. See, now if you are taking myocardial infarction in pregnancy, you would not have seen any cases in the myocardial infarction, but you be in touch with the PhD people and the cardiologist and even the anesthetist, whether they have seen such cases and what will be the result. So when you publish a paper, means the work you are doing only should reflect in the paper. Attend conferences and update your knowledge. Join academic societies and engage the colleagues to social media and expand your professional network. See, now our TNFOG. See, now Tamil Nadu Federation, we are having 20 societies. From the 20 societies, we are having 3,000 and more members. 3,000 members, if they are going to start presenting papers, means it will be very, very useful. But this research methodology workshop is organized by started by our president, Dr. Ramani Devi Madam. See, what is the attendance? It is only 17. So it itself denotes that how many people are presenting our papers. If you attend the conference and if you attend this webinar only, you will have an interest to present paper. What is that? We will do that. Every time we are doing the practice, that is different. This research methodology, this is the first time we are doing in TNFOG. In spite of that, the attendance is very, I'm not telling that everyone should attend because everyone has the commitments. But if you attend the workshops like this research methodology only, you will have an interest and you will try to present papers. So that is the nowadays it is very, very needed. You cannot tell that I am working. Documentation is very, very needed. If you present papers only, everyone will accept that you are working. So find collaborations who can help you improve your research and increase its visibility. Then always, whatever the topic you take, it should be short and sharp. The introduction can be with the four sentences only. If you want to do the introduction, reading the introduction, they should read the abstract. Reading the abstract, they should read the full articles. Why the study is needed. Now I am going to talk about HPV vaccine. Why it is needed. What is the gap in the literature would you like to bridge and what is at the end? If you are going to talk about the HPV vaccine means, you can come to the conclusion. The adolescent, if they are vaccinated in future, what is the purpose? The cancer cervix incidence will be reduced because the cancer cervix is one of the common cause of mortality in the older age. So what is the hypothesis? So in the 4 sentence, if you are going to give HPV vaccine to your adolescents, in future, there will be the incidence of cancer cervix will be reduced. So that is the point and the catchy word we are getting. See, again, this HPV vaccine, our finance minister, secretary, 2024, government to focus on vaccination against cervical cancer because she talked about the HPV vaccine. Now the HPV vaccine knowledge is, awareness is more with everyone. They are coming and asking whether HPV vaccine has to be given. So we have to tell, if you give the HPV vaccine only, the 2030, what will happen? 90, 70, 90. What is the 90, 70? 90% of the adolescents should be vaccinated. 70% of the patient women should be screened for CA cervix and 90% of the screened women who had disease should be treated. Then we can reduce the incidence of CA cervix in 2030. So everything, the current, that only I told. Now, if you are going to present a paper on COVID, no one will read. If you are going to present a paper on HPV vaccine, that I have counseled 100 adolescent girls, and they had the vaccine with no side effects. What was the side effect? Whether fever, anything, no side effect means after reading this paper, in the other district, other 100 the adolescent people will have the vaccine. So whatever is current, that is very, very important. The introduction sets the stage for the research work and it should answer the question, why is this work needed? So if you are giving the HPV vaccine, CA cervix can be reduced. That is 90, 70, 90. That is the point should go to the mind. That then the paper will also get accepted easily. So good studies identify a knowledge gap that the researcher paper fills. And if an author starts off with a long review of the literature in the introduction, if you are going to write 1 page full of introduction, no one will read. What is the message? What message he is going to give? That's all. The article will get rejected. The last sentence or 2 in the introduction. So if you write the introductions also, the last 2 sentences should tell, if you have HPV vaccine for your child, in future, the incidence of HPV CA cervix will be reduced. Then automatically the paper will be read and even it will be the promotion for HPV vaccines. So the result obtained, as I told the result. Now you are telling that the screening, 100% adolescent women, 100% women has been screened for the CA cervix. It can be with the pap smear, or it can be with the viability, or it can be with the colposcopy. But if you are going to write in a paragraph, 50% was done with the pap smear, and the classification was at CAN1, 100%, 100 patients were done the colposcopy, and the biopsy was taken, and among these 2 persons were identified as CA cervix. Rather than writing in the paragraphs, put it in a table and in a figure. Always, that is also colorful tablet, bar diagrams, and the pictures and the chart. If you put like that, it will be easier and the people can understand. So this is the way pap smear was done for 20, and viability was done for 20, and colposcopy was done for 20. Among these, what is the sensitivity? What is the specificity? What is the final conclusion? Colposcopy guided biopsy will confirm you the malignancy. So like that, it should be in the table and figure rather than with the sentences. The result section should be no more than 1 manuscripted page, only 1 page. Detailed tables with the most important results are pointed out in the next. See, like this only. This is a old slide that is with the COVID season. What is the activity of the virology, journal of the hospital, how many days patient was admitted, what was the vaccine, what was all the types of vaccine given, which now this COVID vaccine, again, the Covishield is going back. What to do? So the virology viruses. So depending on this, after reading this, they can know which vaccine is good, which type of people this vaccine is needed. Similarly, if you are going to talk that in the hospital, so many maternal mortality means if you are going to tell these patients are delivered and they went for the PPH like that, and finally they ended in a hysterectomy, DAC, and finally mortality. So this is the jar diagram. If you see this, most of the cases died due to hemorrhage. MMR, hemorrhage may be direct or indirect, and yellow color tells their hypertensive disorder, and indirect causes is green color. So you should make some colors and the chart bar diagram and the chart such that everyone can understand, and they will concentrate on the anemia also. So the paper should be useful for you and the others. Conclusion is, overall publishing a researching paper requires careful planning. What paper to be selected, what is now needed, what is the journal you are going to tag, and what is the abstract main point. And attention to detail and perseverance. Continuously you have to do. If this is not accepted with the reviewer's explanation, you go for the other. By following these tips and tricks, you can increase your chances of getting your paper accepted in a reputed journal. Thank you. So all of you try to present papers and enjoy the movie. I think this movie is going to get released tomorrow. Our TNFOG member, Dr. Deepa Mugutan's daughter, is also acting in this. Your mind also should get relaxed. Then only you will be ready for the next paper. Thank you.
Thank you, ma'am. Wonderful presentation. Slides are also very wonderful.
Madam, it was very nice and informative. And nowadays in medical colleges, PGs, before they take a topic to get approved, they have to go through 2 or 3 steps. They have to attend the research methodology
class
conducted by the university, and then attend the PG Scientific Academic Committee, PGSAC meeting. They have to present it. They will correct all the mistakes, and then they will present it in the ethics committee. Then they'll give a certificate that you can take this topic. This will be completed in their first year itself. Within 2 months after joining, up to 12 months, it will be completed, and they'll take the study for 18 months. So it is has to be improved, madam. It's very, very important aspect which is lacking in our country.
Yes, Sujata. We are promoting. We will try to promote.
Yes, madam.
Thank you.
We'll conduct a lot of things because private practitioners also they are presenting a lot of papers in conferences, and they find it difficult. So this will be very useful for everyone.
If you have the statistics only, we can talk as per TNFOG guidelines. This is the protocol has to be followed for HDP, for a PAH. Now see the doctor from Trichy. What happened? I think she is from Trichy only. She is a twins. She developed a PPH. She is a eclampsia. Whatever, Pudukkottai hospital she died, no? That she is also a gynecologist. So we should have the statistics and we should tell. As per her, we are talking about ACOG guidelines, RCOG guidelines, VIGO guidelines. What we are talking about TNFOG guidelines, nothing. We will try to do that.
Yes, madam. Yes, madam.
Commercial, ma'am. Sambat ma'am or Radha ma'am, just introduce Chitra madam. We can go for next speaker. If you don't mind.
Radha, you have to unmute.
Good evening,
One
Chitra
sec-
madam.
one second, ma'am. One second, ma'am.
Hello, ma'am.
Hello, ma'am.
Hello, ma'am.
சித்ரா மேடம்லாம் அறிவு ஜீவிங்க.
Academic.
No, madam. Shall I say?
One second, ma'am.
Yes.
Please.
Good evening, Dr. Chitra, Professor and Unit Chief of Ops and Gynae, PhD Institute of Medical Sciences, Coimbatore, Tamil Nadu. It's a great privilege to introduce you. You are affiliated to past President Kova Yogi Society, Scientific Committee member of TNFOG 2019, member of IUG and ISOG. Special achievements is urogynecology, Harris pregnancy, honored by Teaching Excellence Award 2015 by the institution. Postgraduate teacher and examiner from 1998. Faculty in the Institutional Medical Education Technology Cell. Has been invited as faculty for many national international conferences. Organizing secretary for many department conferences and CMEs at PSG IMSR. Has many publications in national international index journal. And also she was the quiz master for the last year TNFOG quiz time. Welcome, ma'am.
Thank you, ma'am. Thank you so much, ma'am. Can I share my slide, ma'am?
Yes, ma'am.
மேடம் நீங்க ஷேர ஸ்லைட் பண்ணும்போதே கேரளால போயிட்டு எவ்வளவு வேலை பண்றீங்க பெய்லி சாரோட அதை வந்து டிஎன்எஃப்ஓஜில கொண்டு வாங்க மேடம்.
மேடம் அவங்க என்ன கூப்பிட்டாங்க மேடம் பண்றதுக்கு.
இல்ல அதே மாதிரி நமக்கும் ஒரு கைட்லைன்ஸ் கொண்டு வரலாம். கேரளாவோட கைட்லைன்ஸ் மாதிரி we will also
Sure, madam. Sure, madam. At the outset,
Big screen slide.
At the outset, let me thank Sampath Kumar madam and the organizers for having given me this opportunity. It's indeed a wonderful topic. I told madam all the students are having this research methodology. They have to do that before when the first year result, like madam told. But anyway, madam said we must do it because the other faculty who might have forgotten about all these things is important. So, in fact, this topic which madam gave me was little difficult. I had to really look into lots of things because it's a dry topic, but it is very, very important. And madam gave a very, very impressive talk just before me. Thank you, madam. And so first, like madam said, publications are very, very powerful tool. When you do some publication, you become recognized. Someday everybody knows who are you. Because only when they read the articles, they will know, oh, this particular person has published this, so she must be a good person, or she must be having talent, she's quite knowledgeable. So that is a recognition that you get. And it's not only to you, but it is also to the institution, to whichever, it could be a private medical center, it could be a government medical center, wherever you are. They will recognize the particular institution, say that that particular person has come from that institution, and it adds value to not only to you, but also to the institution. And automatically, the more number of publications you have, there will be definitely more chance of funding because there are so many funding agencies which are there, ICMR funding, etc. So only if you know what is there, you will be, only when you start publications, you will know what are all the ways in which you can enhance a publication, what are all the aids that you can get. So automatically more funding will come to you. And of course, all of us know that there is so much promoted, you should have a publication. So I'm sure all of us remember this, publish or perish. It was initially coined by Coolidge in 1932, and now it has become a harsh reality because everybody, the rule is that unless you publish, you will not get your promotions. And I'm sure the same thing holds for government hospitals also. So just look at this chart. Initially, we were saying you publish, and then it came publish or perish. But now they say you publish in high impact journals or perish. And now they say you publish frequently in high impact journals and maybe you may not perish. So what is this word that we've seen? High impact journal. That is what we're going to talk about in today's lecture now. So high impact journal automatically means it's a journal which is reputed. It is a journal which is well recognized. It is a journal which is much sought after. And without telling, it's a journal in which it's very difficult to send a publication. Like how we have elite schools, we have elite colleges. So when you look at the name of the colleges, we know, okay, so this is a a great college. It's a great reputation to go into that college, and it's a much softer. So just like that, a high impact journal means it's a very, very reputed journal. So the higher the impact, greater is the credibility. So you can have journals with a factor of maybe 100. Some could have a factor of 1. So that means in that order, it comes down. So higher the impact factor, greater will be the credibility of the particular journal. Now this Eugene Garland, he was the first in 1960. He started this impact factor, and this impact factor till now there is no other better factor. But now towards the end of the lecture, I will tell you what are the problems and disadvantages of this impact factor, and tell you what are the ways in which it is being overcome. So for lots of decades, they're only using this to test the credibility of the particular journal. So that is how he started this impact factor. So what exactly is the impact factor? It is a measure of the number. So it's really, you suppose you publish in a journal. So how do you know the impact factor? So when a journal is there, it depends upon the number of times other people have used your article to quote it as a reference. So that is basically the impact factor. So that it's a measure of the number of times an average paper in a journal is cited during a year. So supposing you've published an article on liver disease in pregnancy. And supposing it's been quoted as, it's been used as a reference 20 times. So that means 20 times that particular article has been cited. So in a paper, in a journal, there might be many papers in a journal. So for each paper might have different number of times it has been cited. So overall, they will take the total number of times it has been quoted as a reference, and they will take the total number of articles which is published in that particular journal for a period of 2 years. And in one particular year, in the third year, they will find out how many times this particular article has been quoted as a reference from that particular journal. And that will give you the impact factor. I'll tell you how it is being measured. So basically, the higher number of citations coming from a particular journal, it means the impact factor is more. So when deciding the perfect journal for your paper, this metric, so there are various metrics, but this one important metric is an important tool to guide you, to help you through the process. So now, so basically for an article, if you have less number of papers, in particular in a journal, if you have say 20 papers and more number of citations, the higher will be the impact factor. Similarly, if there are more number of papers but less citations, lower will be the impact factor. So impact factor, it has a, it really has an impact on that particular journal. The higher the impact factor, better will be the journal. So now, like I told you, it is the average number of times an article from a journal published in the past 2 years has been cited in the journal citation reports. So how will you get this? So it's the total number of times its articles were cited during the previous 2 years, divided by the total number of citable articles in the journal for the past 2 years. That will give you the impact factor. So just for an example, so let's take an article and the number of times it has been, say in 2014, because you have to, in 2 years, they will tell number of articles which are published in that particular journal. And for 2 years in that, so say, so the number of articles published in 2013 and 12 has been totally 40. But the number of times in 2014, the number of times the articles has been quoted is 58 and 123. So the citations has been 181 out of the 40 articles which has been published. So totally, the journal impact factor comes as 4.5. So automatically, without telling, the numerator should be more and the denominator should be less. So higher the numerator, the numerator is the number of times that particular article has been quoted. And the denominator should be the articles. If this is less, automatically your journal impact factor becomes more. So what are the plus points and what are the negative points of this impact factor? So it tells you about the quality of the journal as a whole. Supposing in a journal, say you're taking the obstetric and gynecological survey, for example. So it doesn't tell you there might be 20, 25 articles which is there. It doesn't tell you about each individual article. it tells you the quality of the journal as a whole. Because suppose you have 25 articles, one article might not have been cited at all, whereas another article might have been cited 100 times. So it's taken the total number of citations from a particular journal. Okay, so your journal, your article might be there, but it might not have been cited at all. It might not be quoted at all for a reference. So it doesn't tell you about one particular article in a journal. However, it tells you the quality of the journal as a whole. That is one main disadvantage about this impact factor. So it doesn't reflect about a particular article. And but generally, the thumb rule is the higher the impact higher the impact factor for a journal, these journals generally have good articles. But however, the opposite is also true. It doesn't mean that if you have published an article in a low impact journal, it doesn't mean that is a poor quality. It might mean that because a particular person could not get access or could not publish in that particular journal, he or she had to publish in a lesser well-known journal, which might have a low impact factor, but the journal, that particular journal might be good, that particular article might be good. So both is not true. Just because you publish in a journal which has a good impact doesn't mean your article is necessarily excellent, but it's supposed to be good. But it doesn't mean that if you publish in a journal which has a low impact factor, your article is bad. That also is not. That is one disadvantage of the impact factor. So now this impact factor, supposing it's not a fixed number. Today your impact factor for a particular journal might be 5. Tomorrow it might be 6. It might become low. So if it becomes more and more, that means the article is becoming better and better every year. Whereas if the impact factor comes down, it means the article, it's not able to meet its standard and it's becoming lower. And unfortunately, if you have a new journal, it will only get its impact factor after 3 years, because you've already seen the way in which the impact factor is calculated. It takes a total number of articles which are published for the past 2 years. And then the third year, the number of times this particular articles from this particular journal has been quoted, that is only taken as the numerator. So only after 3 years, you will get an impact factor. So all new journals will not get an impact factor immediately. So how will you find the impact factor of journal? Because the second, third slide that I showed that it's very important that you publish in a journal which has a high impact factor. Otherwise, you will perish. Okay, so how will you find the impact factor of a journal? There are 3 ways in which you can find it. One is you can go to the journal official page. The next one is to find out the latest Thomson-Reuters journal impact list. He's a person who started this. Okay, impact factor. And the third one is there's a website known as Bioxibo. All this is important because it's very useful for anybody who's trying to find out. Because all journal articles, all journals will not tell you what is the impact factor for that particular journal. And it's very important that you publish only in an index and a journal which has a high impact. So that is very important. So you must find this out. So 3 ways. So I'll just tell you one. I said the first one is journal official page. So this is what is it. So this article on frontiers in plant science. So we just open that official page. You see the impact factor is 6.6. So this is good. So it doesn't mean that just because it's 6.6, it is good. So it depends upon, it will compare with the other journals in that particular, in that particular category. Okay. So it doesn't mean that there's a one particular number to say it's a good impact factor. So it depends from discipline to discipline. Plus the second one is, this is taken from your Thomson-Reuters. Just go and Google and put Thomson-Reuters impact factor. It will give you the list. So this list, if we just say this list, the topmost journal which has the highest impact factor is Cancer Journal, Clinical Cancer Journal. It is 115.84. New England Journal, I'm sure all of us know about this New England Journal Medicine. It is only 55.83. I wanted to tell you all about obstetrics and gynecological survey. It is only some 5.6.2. That's an article which is, I think many of us would be seeing this journal, isn't it? It's a very good article as far as all of us are concerned. But just look at the impact factor when you compare it with New England Journal, which is 155. This is only OG journal of survey is only 6.2. So this is the way. You just put this, Google this, Biox Bio. If you just put this biox bio and put the name of the journal, automatically will come with this. This is the page. So you just know that this is the impact factor. And the advantage of this biox bio is it will also tell you what was the impact factor the previous years also. So by looking at it, you will know is the journal, becoming better, or is it not becoming so good? So what is happening to the current status? So there's the various ways in which you can find out what is the impact factor of the particular journal. Okay. So there are a lot of criticisms because all of us are pressurized that you must only publish in a journal which has a high impact factor. But there are lots of loopholes in that by getting the impact factor, because like I said, it's total number of citations by the total number of articles. So there are many things which are not taken as articles. Like supposing you put a publisher editorial letter or a case report. All this is not taken in the denominator. So they say only peer articles, original articles, only more meta analysis, only that will come in the denominator for most of the impact factors. So as a result, many of these, if you write case reports, etc., it will not become a citable article. So if a journal is accepting all that, then the number of articles in the journal become more, but all these things, they cannot be quoted as references, and as a result, the impact factor will become less. So the journal might be good, but if it's encouraging more of letters to the editor, more of case reports, automatically the impact factor becomes less. So there are a lot of loopholes. So people have said the way in which it is calculated is not correct, because there are lots of what really constitutes a citable article is it's not ethical, but there are many drawbacks in that. Okay, because you're not going to include editorial letters and comments, etc., are not being included at all. And the other thing is, they say that there's so much of a pressure. You might be, you might be only concentrating on trying to make your journal having a good impact factor. So the publishers might go to any level. They might misuse, and then they might go to any extent to see that the journal has an impact factor. That's what they're trying to say. So they might go on pressurizing the authors to go on self-citation, whatever they've done, to go on self-citation, so that the citations, the references become more and more, and the impact factor will become better. So so it depends. So it's not very transparent. You can't, everything is not put in black and white, because he's releasing the list. We do not know what all has happened behind the screens. So they say the impact factor is not transparent. It has a lot of problems. So because it's not transparent, not reducible, not reproducible. So it may not be very good. So there are lots of, because it's possible to manipulate the impact factor. So even if a journal which has a good impact, but it may not be the real impact factor, it might be a manipulated impact factor. So they say, and it causes a lot of publishers, you're not able to, if it's not getting accepted, lots of publishers are forced to publish in low impact factor. And so we do not know, good research might get published in a poor impact factor, whereas poor research might get published in a impact factor which has a good impact factor. So this is a lot of limitations. Okay. So to overcome all these things, they said we should start. There are lots of societies which join together, and one thing is a DORA. So DORA is a San Francisco Declaration on Research Assessment. So they said we will stop using impact factor for determining one scientific merit and accomplishment. So actually, wherever you go, the first question that people ask when they see your publication is, have you published in a journal with impact factor, or have you published in an index journal? So, the automatically an index journal also will automatically have a better impact factor. So when you're asked, if your journal is published in a journal which has a high impact factor, you're given more credit. So they say, because there are so many loopholes when you have an impact factor, it may be true, it may not. It's possible to manipulate the impact factor, and just because you publish in a journal which doesn't have an impact factor doesn't mean that you're not a good researcher. So they say this puts a lot of pressure on the researchers. If you're given a job, they will automatically ask you, which journal have you published? This is a journal, a reputed journal. Has it having a good impact factor? So if there are two people competing for the same post, automatically the person with a more publications in more indexed journal or in more journal with impact factor, he will get the preference, which is not very true. So they're trying to say that you cannot be judged by just publicizing in a journal which has a high impact factor. So that is why they say they must forego this impact factor whenever, especially when you want to find out whether a person, you have to choose a person for a job or not, to assess whether that particular person has accomplished what is his merit. They say you should reject using this impact factor. So a lot of people are now against impact factor, but it's still not coming to use. But as of now, you still have an impact factor. So basically, we should still continue to publish in a journal which has a high impact factor. So the next thing that we move on to is an index journal. So these are two things. You have to publish in a journal which has a high impact factor. You also have to publish in an index journal. So what do you mean by an index journal? So index journal is a scholarly publication that has been selected by a database or an indexing service for inclusion in its database. So that means you have your journal. Supposing we our journal of Jogi, for a long time it was not indexed. Only now recently it has become an index journal. So it was just a journal, but to become more important, they're trying to make it an index journal. So that means that particular journal has been selected by a database. So by PubMed, it has been selected by PubMed. So it has been selected by that particular database and said, okay, fine, your journal is accepted to be included in our database. So that means it is an index journal. So there are certain databases which are indexed. So for your article, for your journal to get into, to belong to that category, then it becomes an index journal. So, how is it more prestigious? Because the index journal has certain qualities. There are certain, I mean, you have to have certain rankings or certain ratings. They rate, okay, have you done all these things to get into and become an index journal? So so all these articles which you publish in that should have undergone a peer review. Madam was talking to us just about just earlier about what is a peer review. So all articles which are published should have undergone this process of peer review. They should be of a good editorial quality. They should have good academics. And so when all these criteria are fulfilled, then only your article will get will become an index journal. So once you have an index journal, that means your journal is meeting certain good qualities, and it is okay. It's meeting some standards. So you should try to send a publication to journals which are indexed and which have an high impact factor. There is no point in sending it to a non-indexed journal, because now the NMC is very, very particular. I will come to it later, that all articles should be only published in indexed journals. Okay, so indexation of a journal is considered as a reflection of the quality. So if you know this journal is indexed, that means the journal has some set standards. So it's a higher scientific quality. Okay, so what are all the indexation services that we have? So you have Index Medicus, you have Medline. All of us are very, very familiar with PubMed, Embase, Scopus, EBSCO, and Scirus. So all these are certain indexation services. So if your article, so your article should be in PubMed, that means it's an index journal. Okay. So recently, other indexation services are also included, DOAG. So this is direct open access journals. All this also, initially they were saying it should only be hard copies, but now even open access also is accepted. That has also become an index services. And Index Copernicus, Scholar, all these are certain indexation services. So you can just see whether this particular, you can put your article and then say, if you want to know whether it's indexed, you can just put this and say, is it there in PubMed? If it's there in PubMed, that means that the journal is indexed in PubMed. Okay, so many services are there. But generally, as far as the medical journals are concerned, the main journal indices in medicine are Thomson ISI Journal Citation Reports. We saw that initially in JCR. And then Elsevier's names also must be very familiar. Elsevier's Embase, Medline, PubMed Central, Index Medicus, Google Scholar. So all these are certain journal indices which are as far as medicine is concerned. So let me see if your journal is in any of these databases. If it's there in the databases, that means your journal is an index journal. So when you look up, when you want to see You identify, suppose you go to the library and then you say, okay, I want to publish in this particular journal. You must immediately see whether this particular journal is indexed. So you have to go and see, is this journal indexed in any of these databases? Okay, so so all researchers, it is very important that you publish only in index journals, because it indicates that your journal, that your research has undergone a certain level of scrutiny and validation by experts. So they will know that if your article is in that particular journal, it is definitely undergone certain scrutiny and it should be worthwhile reading it. It also helps you to increase the visibility and impact. So many people will be reading their articles and you will become more better well known, and your article also will be used by many people and they will start quoting it and they will use it as a reference. So overall, being published in an index journal is a significant achievement for researchers. So it should be your aim. Whatever you publish should be only in an index journal. There is no point of publishing in a non-index journal. So there are certain predatory journals. So it means, so you just, so many times when you open your mail, every day somebody will be saying, send articles for publication. So what they will do is all illegitimate, because the day you send it, tomorrow they will say it's accepted for publication. That means not undergone any peer review. You send an article, it looks like as they're just waiting for you to send an article. And then you also very innocently, you will send it, you'll be very happy that they've accepted for publication. But when you send it for your promotion, they will say this particular journal is predatory journal and you cannot be accepted for, as you can't count it as a publication. So these predatory journals very quickly, without any peer review, they will accept for publication. You only have to submit the publication fees. And the next day, they say this journal is, this article is published. But what they will do is it becomes very unethical, because many people, whoever writes such articles, they will cook up and write. It may not manipulate the data and publish. It's not maintaining any standards. Now, so like I said, Scopus Index, there are so many, the common things are Scopus Index journals. So it's one of the most largest reputable abstract and citation database. So the other thing that I said is ISI indexing, the first one that I said. So this again another website. You just go there and you could, this also a indexed database. Scopus, this name is also becoming very familiar, just like a PubMed. People will ask you, have you you send it to Scopus? So there's again the world's largest abstract and citation database. So these are some names, and Google Scholar. So all these databases are accepted by your RNMC. You can publish in any of these things. So all these are certain in a common indexed journal. Your journals could be in any of these things. If it's found in all these databases, that means your journal is an indexed journal. Okay. PubMed, I'm sure these are the few things that all of us are familiar. PubMed, I think all of us are very, very familiar with that. But these are other things. You can go to Google Scholar and see whether this particular journal is indexed, or you can go to Scopus. Okay. So now, lastly, I would just like to tell you what is the NMC criteria for publications. So NMC has made it very, very clear that all of us should have research publications. The research publication should be only original papers. Research articles should be meta-analysis, systematic review, and case series. It's not a single case. So that means no case report is accepted as a publication. It should be a case series, or you can have 10 cases of acute fatty liver pregnancy. That could become a case series. You could do a review of literature and then send up as an article. Or you could do an original article and then send publication. Or it could be a meta-analysis. Now the latest is meta-analysis and systematic review. So all this will get automatically sent. They will accept all this for publications. So the NMC says you should have only this type of publications. And it's very clearly stated, it should be indexed. The journals in which you are submitting your articles should be indexed in Medline, PubMed, Central Science Citation Index, or Science Citation Index, Embase, Scopus, DOAG. All this only, he has very clearly said it should be indexed. Your journal to which you're sending should be indexed in any of these. If it's not indexed, then you can't, it will not be accepted as a publication. So from the previous rules, what is the current recommendation? Now earlier, Copernicus index journal were also valid, but now they've removed that Copernicus index journals are not valid. And earlier, they used it only print journals were compulsory, but now even online, DOAG is online. So they, even if you publish in DOAG, that is also accepted. And the number of publications is, you should have 4 journals. I will tell you, I mean, you should have 4 publication. But another important factor is, usually we'll say you should either become first author, second author, or you should become a corresponding author. But now they say any number of authors could be there. But to be on the safer side, it is better that you either be the first author or the second author or the corresponding author. Only then many institutions, they will accept. Suppose your name is somewhere third or fourth. You may not get the credit for being, you can't say for publication because you do not know, NMC rules might keep on changing. They may say you must only become first author or second author or the corresponding. So to be safe, your whatever publication you send, you should either be the first or the second author, or you can put your name as a corresponding author. Only then it will be accepted as a publication. That will be the safest. And the number of publications for use, if you're an assistant professor, you have to have at least 2 publications as per NMC criteria. That means you should have published in an indexed journal, 2 publications. You should either be a case series or an original article or a systematic meta-analysis or systematic review. So from assistant professor, from SR, assistant professor, you must have 2 to become an associate professor. Once you become an associate professor, you want to become a professor, you should have 2 more, the same criteria. So totally, you from assistant professor to professor, you should have 4 publications. And all these publications should be in an index journal. So over the past few minutes, what I've told you all is about an impact factor and a index journal. And what is the NMC criteria? So impact factor, so basically, higher the impact factor, it means your journal is better and it's a reputed journal. So it's worthwhile publishing in that particular journal. So it's very easy to look up and find out what is the impact factor for the particular journal by looking the 3 things. You can see the journal review, journal page, official page, or you can go for Thomson index and then see for the impact factor. Or third one is Biox Bio. I think that is very, very easy. That will tell you what is the impact factor. Now our Jogi, the impact factor is almost 1 when compared to New England Journal, which is 55. So, but at least it's good because it's an index journal, or the Jogi is an index journal. So you will know where the impact factor. Suppose you have to take all the OG journals. Anybody will say the survey is a good journal, but if you just look at it and compare it with the other impact factor, it's low down only. But overall, when you compare it with OG journals, it's quite good because the other journals, British journals, etc., is even lesser. Maybe it is only 5 or something like that. So in survey seems to be the best among OG journals. So that means that particular has a good impact factor. Okay. And index journal, you must only send it to an index journal. Index journal means all those journals which are articles in the journals are peer reviewed. It has a set validations. Only then, if it fulfills all the criteria, only then the article will be accepted for publication. You can't send it and tomorrow it can't be accepted for publication. So you must send all your articles only to an index journal. So for NMC criteria, you should fulfill at least 4 publications to become a from assistant professor to become a professor, you should have at least 4 publications. And without publications, the rule is you will perish wherever you are. I'm sure even in government hospitals, that rule has already come or it will come. You have to have publications, not only for you to become well known, but you also have a sense of satisfaction that you've done something and people will recognize you. Okay, so I thank you all for having patiently listened. And I thank Madam for having given me this opportunity. It is quite a difficult task for me to go through this to understand and then try. I was wondering why Madam is punishing me to giving these 2 topics. Okay. Anyway, I like to do all these things because it makes me read more. So thank you, Madam, for having given me this opportunity, and thank all the people who have listened. And I thank Madam so much. She told me, Madam, you must only do this. She and Ramani Madam said you must do this. So thank you, Madam. And I hope many of you, whoever listened, would benefit by this. Thank you so much. thank TNFOG for having given me this opportunity.
Thank you, Dr. Chitra Madam. We will post this in the YouTube. Those who have not at all attended, they will use it. Wonderful
Thank you,
talk,
ma'am.
Madam, as
Thank
usual.
you, ma'am. Thank you, ma'am.
Any
Ma'am,
doubts? Anureka?
yeah, ma'am. Yeah, good evening, ma'am. Actually, I would personally like to thank Chitra ma'am, because when I was thinking of this topic, we were searching for a person who's very apt to talk about this, and now I feel so much glad that I've done justice. And ma'am has really told in a very simple and also to the point, and it was very useful for. I mean, it will be very useful for all the persons who's working in medical college setup. So actually, I would like to thank ma'am personally to my heartfelt level.
Thank you, ma'am.
And
Thank you,
I
ma'am.
thank Ramani ma'am, I thank Sampath ma'am for giving us an opportunity to be here and to meet all of you for these 2 days evening. And all of you are like very busy persons, and you have spent the time for us, exclusively for us. And I should thank each one of you personally. Thank you, ma'am.
Thank you, ma'am.
Thank you,
ma'am.
Anureka.
Pleasure, ma'am. Pleasure.
Thank you,
Whole
ma'am.
program was designed by Dr. Anureka only.
Actually, I was thinking of the topics and speakers, ma'am. I was thinking of the topics and speakers, and this has come out very well. And each and every one of the speakers have done their job clear.
So formal vote of thanks. So first I thank Dr. Ramani Madam for the 2 days workshops. And I should thank Saravana Kumar, our treasurer, and the speakers on the first day, Dr. Nivedita, Dr. Anureka, Dr. Epsiba Madam, and Dr. Path Sardi, and the chairperson being Dr. Vidya Prabhakar, Dr. Rajshri, Dr. Saravana Kumar, and Dr. Revati Janaki Raman. And the second day, the recap by Dr. Madhumita, and today's speaker being Path Sardi, myself, Anureka, Ramani Madam, and Dr. Chitra, and the chairperson, Dr. Radha Madhavi, Dr. Uma Velmurugan, Dr. Sujata, and Dr. N. Tamilchelvi. And the topics was wonderful topics. I think if everyone is okay, we can do it after 2 or 3 months. But we should have a good attendance and we should promote this. Madhumita, thank you. And our event manager, Sri Priya. And she
Thank
was
you,
the
ma'am.
one.
Thank you so
Thank
much,
you
ma'am.
so much.
Thank you, all of you all. Thank you so much.
Thank you, madam.
Thank you, madam.
Thank you, ma'am. Thank you so much, ma'am. Thank you.
Thank you.